Bruce, you must have something really good too.
Of course I do. It's Bruce Danielson, and I guess I'm here to entertain you too.
Well, we'll call this Tuesday, August 13th budget hearing meeting to order. Welcome everybody here and those watching at home. First of all, I will look for a motion to approve the minutes from last week's meeting.
So moved, Erickson.
Second, Neitzer.
Okay, got it. Motion made by Erickson, seconded by Neitzer. Roll call? Or don't we do a roll call? Okay. All in favor?
Aye.
Aye. Those opposed? All right. Well, we'll get the ball rolling today with Director Franken's presentation. Welcome.
Well, good afternoon. Jill Franken, Public Health Director with the City of Sioux Falls. I am here to present our 2020 proposed budget for the Health Department, and got to give a couple thank yous. One is to Amy Richardson, who led this from our team and did a great job this year working with finance. And I also just have to give some credit to Sean Pritchett for his infusing a new perspective and a new way for us to look at our budget and align it with our priorities for the city and the community. So I think it was a worthy endeavor, and I appreciated kind of infusing some new life into our budget process. And then just to all of you, thank you for your support of the department over this last year. It's been well appreciated. So I think to set the stage, I'd like to show you a quick video of why public health is so important for our community. As One Sioux Falls, we prioritize safety and health. Together with our city colleagues, we strive to embody safety, teamwork, innovation, character, and respect in how we serve one another and how we serve our community. We see the community of Sioux Falls as our patient, and we work to improve quality of life by addressing factors that impact the health of our community and by providing an open door to primary healthcare services. We know that for a community to be vibrant, to recruit and retain employees, to help children learn, and to foster innovation, it must first be healthy. We live in a community where food deserts impact access to healthy foods, where families may have to choose between paying for housing or paying for medical care, and where life expectancy can vary as much as 14 years between one neighborhood and the next. Yes, even here. We live in a community where every day residents are trying to manage one or more chronic conditions like diabetes, high blood pressure, or depression. Yes, even here. Falls Community Health is designed to be a medical home for individuals and families, a place where our skilled and compassionate staff address the needs of the whole person. It might surprise people to know that tooth pain is the #1 issue that keeps children out of school. Our dental clinic not only serves children, but also adults needing care, many of whom arrive early in the morning with emergency dental needs. This is a critical service to our community, and we need to ensure we can recruit and retain clinical staff to care for our friends and neighbors. Our team approach at our main clinic and our 3 school-based clinics ensures each patient receives care and support from medical providers, nurses, and other staff, including counselors, case managers, and social workers. Having access to care is only a small part of what makes us healthy. Many of the strongest predictors of health and well-being fall outside of the healthcare setting. We live in a community where our zip code may be more important than our genetic code, meaning our neighborhoods can actually shape our health. Yes, even here. And that's why we ensure our community is prepared for emergency situations, has access to quality ambulance services, protects residents and visitors from mosquitoes, and monitors health conditions around the community in neighborhoods and at facilities such as restaurants, hotels, and more. Our Live Well Sioux Falls initiative enjoys great success bringing community partners together to identify and address health needs. We live in a community where adults are not meeting recommendations for fruit and vegetable consumption or daily physical activity. Yes, even here. From promoting healthy food access and physical activity to reducing tobacco use and other risk factors for chronic disease, Live Well Sioux Falls actively pursues policies and practices through a prevention and health equity lens that moves our community toward optimal health. Through our community health needs assessment work, a new priority has emerged. We live in a community where individuals are suffering from mental illness and from addiction to drugs or alcohol, otherwise referred to as substance use disorder. Yes, even here. These are words from Melissa, a Sioux Falls mom whose family was forever changed by the loss of a son as a result of an opioid overdose. Sioux Falls is not immune to the challenges of mental health and addiction. The good news is that we have a number of organizations in our community who are coming together to address these challenges by creating a community triage center. This facility will serve as a therapeutic alternative to the emergency department or jail for those experiencing mental health or substance use crisis. In addition to the triage center, our department is working with partners to raise awareness about mental health and addiction throughout the community because we know these issues impact anyone, anywhere, even here. The places where we live, work, learn, and play can affect our mental health and physical well-being. It is our responsibility to address these conditions around us and to ensure that a healthy choice is an easy choice to make so that all residents of Sioux Falls can live well. All right, well, with that as sort of a framework for getting us started talking about the budget, this also is a snapshot that gives you just sort of a sense of the scope and magnitude of the work that we provide. It's really just a sampling of the dozens of ways that we impact the community and how we measure what we're doing for our community. You can see whether it's our medical clinic or our dental clinic, the work we do to screen patients for depression, the work we do to get them referred in, create a follow-up plan and get them referred to services, whether it's work we do in neighborhoods with our inspection program or our restaurant inspections, our daycare program, and yes, the work we're doing to work with our community triage center. These are all ways that we're striving to make Sioux Falls a healthier community. So a couple of things that I just want to highlight a little bit are a couple of our BHAGs, or Big Hairy Audacious Goals, as we call them, that have really been developed to align with the One Sioux Falls framework. And we are pretty proud that we were the first BHAG that we got completed for the city with the age-friendly community, or becoming part of the age-friendly network with AARP. That's really allowing us to really access and tap into their vast resources in this space and to be able to use those for our strategies that we're going to be employing throughout the community and in partnership with the other departments' strategies to impact how people are able to age well in our community. We also then, the other BHAG we're working on is really to ensure that we have the plans in place, whether they're guidelines, workflows, et cetera, to be able to assure that our first responders can effectively transfer and transport patients to the triage center when it's operational. And that's going to require some work, and we've got some goals aligned with that on how many people we hope will be then diverted through that process, and we'll be working on that. And I thought it might be an important time just to give you a little bit of an update on where we're at with the triage center, as long as we're talking about that. Just so you know, work is progressing with the design for the build-out of the triage center. In the annex, we're continuing to work with Lloyd companies on that. We remain confident that we're landing on a solid operational budget, and all of the initial four partners, Sanford, Avera, Minnehaha County, and City of Sioux Falls, have agreed to fund the first 3 years of operations. The health budget has a line item for the triage center that I'll talk about in a little bit. The mayor's office is leading, actively leading discussions with interested parties who may want to participate in helping fund the build out of the triage center, which in the annex. And we continue to work on the governance structure, and I think, and we've landed on an agreement, a consensus to move forward on that governance structure. And so attorneys are working on a draft of that. So from all that, there will be a number of resolutions and other items that will be coming before you in the weeks to come. So I'll be looking for that, as well as additional updates as we continue to progress, with the timeline still to be operational in 2020 with the triage center. Okay, so let's get into some of the meat of the budget. And so you can see on this slide the budget changes by programs within the health department between 2019 and 2020, and the change that we're seeing with that. But do you have your budget books? If you can draw your attention to page 48, maybe you're already on that. I just want to go through a couple of things that are on that page if you can turn to that. So you can see that we have, that page is broken down between Falls Community Health, or all our clinical services on the top half of that page, and then on the bottom is our community health safety and enforcement, or like our environmental services and other public health activities. So under Falls Community Health, I just want to mention that you'll see there's a line item that's quite an increase in revenue. That's under miscellaneous. That would be, you can see it's budgeted for $123,000 increase. That's actually our Medicaid health home. We participate with a state program for clinics that wish to do additional activities, provide additional services to help improve the health of people who are on Medicaid, and we get additional payment then for that, it's like an incentive payment for that work that we do in addition to our regular reimbursement. So we're anticipating some increases there, and then we're also expecting some increases in our collections for our services in that line item. Then if you go down to the rest of that, it should be pretty self-explanatory. I can go over any questions that you might have in the rest of that section. But then if you go down to the next, under community health safety and enforcement, just a couple of things I'll draw your attention to. You'll see there's a decrease under intergovernmental grants. It shows as a difference of decreasing by almost $95,000. That's related to our Community Readiness Initiative grant that decreased in this it will be decreasing because of federal changes to their federal budget. Those are federal dollars that come to the states, and then the state allocates that money to communities. So we've seen a decrease there. Our charges that are decreasing by almost $50,000. There's some changes in how they're regulating requirements around water testing, and so we'll be seeing less of those tests coming to our lab, our public health lab, and so it's simply just, we'll be seeing less in that area for revenue because of less water testing for that one particular area. We'll still do plenty in other areas. And so then under the expense side, also related to the environmental lab, there's some water testing supplies for our overall, all of our water testing that will be increasing a little bit, but we also are expecting that we'll be increasing some charges in that area to offset that. And then you will see what I mentioned earlier, that there is an addition to our budget for the Community Triage Center on the operating expense side for the health department. $157,000 of that $257,500, or I guess $157,500 of that is from the police department, and that was for detox services that we've currently been supporting for the county detox. That is going to be transferred over to health, and then we've added an additional $100,000 to support the operations of the triage center. So that's on that page. So then if you want to go to the page 49, there are some changes there as well that are reflected in this slide that is more of an overview of that. So I'll kind of go through a couple of those items. So you can see that our total personnel expense will be increasing by almost $550,000 next year. That's at the bottom of that first set of where it says total personnel. $332,000, or the majority of that, is for cost of living increases, step increases, et cetera. We do, however, have almost, we think, up to 8 individuals that could be retiring next year, so we have to budget for that payout next year. That's going to be a pretty big number for us. We haven't had that many retirements in a year, and it may not happen necessarily, but we have to budget, assuming that it could. And then deferred comp for our 457 plan will be seeing a little bit of increase there as well. So you can, that's where that 16,000, but it's 16%, so I thought you might want to know what that's related to. And then under professional services, so in addition to our full-time staff, and before I get to that, I just want to make a mention also, I really should talk about it here, that we did gain an additional FTE this next year for a nurse case manager position in our clinic. That has up to this point and for a number of years been an interim position. And so that, when they're an interim, they're also eligible for health insurance. But they're not a full-time FTE. They're not an FTE in the count. And so we've decided to transition that interim position to a full-time nurse case manager with the city. It's really revenue neutral, or budget neutral, because of some additional revenues that we'll be able to receive with that position, as well as really covering most of the costs of that position already in our budget. Okay? So that's just covering that, and I can answer any more questions you might have related to that. So then if you go to, again, on page 49 to professional services, we have a significant amount of staff, well, they're contracted providers that we work with. Like, for example, Center for Family Medicine, most recently you approved the renewal of that contract in the consent agenda. We've had a contract with them for many, many years, and most recently that was renewed. But about, I want to say 67,000 of that total increase of 389 is made up of that particular contract increase. And then the triage center is also in that amount for that 257,000. And then there's just a couple of additional, we have some software support and some psychiatric provider increase in our contract with our psychiatric providers that are in that number as well. Rentals, you might notice that went down by a decent amount, but that's a number that's calculated for our IT rentals, our revolving fund with IT, so I'm just pointing that out for you. And then training and education, that's gone up about 23% for about 23,000 or so. We receive grants that we have to specifically tie to quality endeavors and helping to educate and train our staff. And so we have put into our budget the ability to have a number of their clinical staff guidelines through software programs that allow staff easy, quick access to the most current best practice or evidence-based clinical guidelines, as well as including some web-based compliance training software to be able to easily get all of our compliance needs met for all our staff training. So that pretty much covers the substantive changes on that page. I'm certainly able to answer questions you have, but I'll just go through that. Our capital overview, our capital budget is pretty lean this year. We have a chemistry analyzer that needs to be replaced next year. The costs of repairs and maintenance are becoming more than it is reasonable, and we do have a life on that has been lived. Dental x-ray imaging machine and water purification system, the same would be for them too, their replacements. So that's pretty much covering 2020 from a capital overview. And then beyond that, that's really all I have to share with you. There weren't really a lot of other significant changes like maybe we've brought in other years to the council for recommendations. So with that, I'm happy to answer any questions you might have.
All right, thank you. Questions? Councilor Neitzer.
Have you determined what the breakdown is of who will kick in what percentages of the operating for the triage center, or is that still
Yes,
discussion?
we have both Sanford and Avera have agreed to fund the operations for $500,000 per year each for the first 3 years, and then the county already budgets $400,000. for that, and so it would be that remaining item under operating that would be covered. Now, that's also an estimate because we're going to be issuing an RFP for those operational services, and so depending on where the organization falls within there, how they, pay for their staff to staff this triage center, that will all kind of vary. But we think that's a really good estimate. It's probably hopefully a little on the high side, we believe, and so we think we're going to be okay there.
And that leads into my next question, and it sounds like you may have answered it. I was going to say, whose employees are they going to be? Were they going to be city employees? But it sounds like this might be a managed facility with independent.
Yes. I alluded to that. The governance is there's been consensus reached of the 4 primary partners that are funding this triage center, and they're working off of a idea of a nonprofit entity, and so that would be, and there would be, that staff would be contracted by that nonprofit to provide those services.
Okay, and have you worked out the and maybe it's already factored in here, I guess I would call it our capital contribution, and the fact that we have a building, is that going to be an ongoing credit, I guess, to us in terms of the operating piece that we put in?
Sure, those are conversations that we're still having. We're still trying to refine and get a good number on. We think we've got a pretty good number on what it's going to cost to build that out, and the FF&E for that, the furniture, fixtures, and equipment. But we're still working through all the scenarios of how that'll be completely funded. It's the intention to have that privately funded for the build out, and so then that'll just kind of, depend on then how we create that scenario for a lease payment, et cetera, on that. I don't know if that answers your question. But.
Yeah, it does. Thank you.
Councilor Staley.
I have two issues that I'm going to address. Coming off of what Councilor Neitzer said, my understanding, Jill, was that the city was going to provide the building. That was the capital aspect we were going to put in, and then the rest of this was going to be covered by other entities. Did I have a right understanding of that when it was presented in the past?
Well, I think we've always indicated that whatever's in our existing budget would continue to support the triage center. I don't think we ever indicated that we wouldn't. We've already had that 150,000+ was already in police budget to manage detox. So in our conversations as a project team and the leadership team, that's always been part of what has been discussed. So
clarify what are you saying has been discussed?
What I'm saying is that when we've talked about the partners and what they will be providing, it's always been understood that the expense that's already been in the budget, that was in police budget, that's now going to be transferred over to health, that would be part of what helps fund the operations. And the additional allocation of $100,000 is really to be able to put a reasonable effort into this. So I don't think we ever indicated an absolute that we would not look at some additional operating dollars. That's never been publicly stated, and we never said that in any of our team meetings.
But if we were going to go back to the public and say, this is how this is playing out, the city is providing a building free of charge, right? We're donating the building, correct?
Well, there's more to it than that, and so to say donating, I don't think that's
Supplying.
the building will be used, but the funding or how we budget that in is yet to be determined based on how much private support that we get.
See, so
because it's the
still
build out that's really going to be a cost. It's
right.
Yeah.
So I just
maintenance.
What I've been from the beginning of when this started to emerge, the question I've asked, and Councilor Neitzer was just asking that as well, is that what definitely is going to be the responsibility of each one of these partners. Because I think sometimes when, and we just saw that with that parking ramp situation, when the city's involved, the default happens that the cost comes back upon the taxpayers in the city. Not that this isn't an important thing, but just making sure that we nail down very specifically who's taking responsibility for what. So that's why I'm saying that I'd like to have definite parameters about what the hospitals are paying. It sounds like that's going to be a 3-year commitment. And then after that's over, if they would decide they couldn't make that commitment anymore, then it could default back on the city, the taxpayers, to fund that more fully. Is that a possibility?
It would be wonderful if I could come to you today to say everything is all wrapped up in a tidy little bow and ready to go because we're in a budget time period right now, but that just simply isn't the case. And so right now we've got that governance structure is really, really important for us to get nailed down so that agreements can be signed, things can be put in writing, and that's what we're working on right now. But there has been verbal agreement for the partners to fund this, and the reason I say the first 3 years is this is that 3 years to prove this as a concept for this community. It is not to say that they haven't said that there hasn't been discussion about supporting this beyond the 3 years, because there has been. But we also know that during that time period, we'll be looking for how do we find additional revenues by billing for services that we can bill for, and how can we look for additional supports through the state, through other mechanisms that can help to support this as well. And how do we provide the right data through these first 3 years that helps us for everyone to understand the return on investment. And that will be a really important piece of this. And so we're all in this. We're all in this, but we also are, there's certain things that we know have to be put in place with the governance structure, et cetera. But I don't know. I hope that answers your question.
Well, it doesn't, because at the end of the day, and again, now more than ever, I think we need to be vetting things out for our citizens. We've got to be conscientious about what we're getting into for future expenses and obligations. So just so we can say to the people, in good conscience, we can say, we're okay for 3 years. We've got, and it would be nice if we could get like the 5-year contract like we have with the ambulance service. But we're okay for 3 years. But after the 3 years, if the hospitals would decide they can't help anymore, then it's going to come back to continue this triage center. It might fall back more on the taxpayers. There's a possibility for that.
That's
right?
not the intention.
But there is a possibility, because we're only guaranteed for 3 years. And I think that
I think you're putting the cart before the horse, Counselor, because we need to get the governance. You need to understand what's in the documents of the governance structure before you're making the assumptions that there aren't going to be pieces put in place with that contract that assure that partners stay in this beyond that 3-year period. So I really think you're just asking questions that are yet to be answered and will be answered. And I also want to just mention that I'm not sure who you all are, I don't know which constituents contact you, but every single person I talk to, anyone that I visit with about this, says we need this and we need it soon, and the sooner the better. And so there is so much support for this in the community.
I'm not absolutely not saying we don't need it, but I think we can never dismiss the mechanics of how we pay for something. And again, now more than ever, we need to be telling the citizens moving forward, this is how it's going to be. There's a little bit of a lack of trust right now in our community as to how we vet things out. And when we get obligated into things and then it comes back on the taxpayers to pay for it. So I think it's great. I'm glad we have more details, but again, a long-term support system on this thing, I'm not hearing that's going to happen in 3 years. I just would hope that it never comes back on the taxpayers to fully fund this thing. And at the end of the day, maybe it becomes down to the county and the city, that we could say to the people, the county will always be there to help pick up the slack of what could be the result. I mean, if the hospitals wouldn't continue to be a partner.
I just want to emphatically say there is absolutely no intention that we, as those that are in this as leaders, partnering with this have any intention not to see this be successful for a long-term solution.
So the second thing I wanted to ask about is, and it kind of ties in with the triage center. I've been having many conversations with the Whittier neighborhood, conversations with the handyman businesses, businesses over there in Indiana and Fairfax, conversations with homeowners who are in that area. And there is a huge concern about what's happening there with a population who is drinking too much, who is perhaps homeless. That it's becoming dangerous over there, and not a healthy, safe place to live. Have you, your department, have you got any ideas about how you can interject yourselves into this and help?
Well, we have been for a number of years. We have a homeless healthcare program, and so we have staff that actually, that's their job. Is we have a case manager who works with homeless populations. We have staff who are trained. We know we have at least 1,500 homeless patients that we serve each year, and so we're working we have a social worker that works with those populations, and so we have a really strong partnership with Bishop Dudley Hospitality House and the banquet, and so we are engaged in those conversations, as well as I know that we have, I know Mary Michaels is getting involved in that space of being part of a group that's looking at accessible housing for individuals, and so yes, we are involved in that space. I also personally know that, you know, in my work with the triage center, that this is something that we know is needed to help people who are struggling and who are in a position, some of which might be, you know, frequenting the Bishop Dudley Hospitality House or frequenting some other support services, but just don't have access to the resources that they need.
Well, and we have a situation of people who apparently who are vagrants. There's a vagrancy element, and people are passed out drunk. They're laying on streets. They're laying in alleys. They're defecating in alleys. There's needles around. I just was up in that neighborhood watch up in North French Avenue. The residents there say we can't even go outside in our homes anymore. The kids were there. We have needles around. So as far as a health issue, it's not only a health issue for the people who are pooping and peeing outside, but I mean, we got a health issue for the people who are having that happen in their yards and being assaulted at night. They're not safe. So health and safety is, of course, the top priority for our community. And the triage center, people have said, let's say there's someone passed out laying on a sidewalk. Are they going to be, because right now, or if there's someone even hanging around that's intoxicated, apparently, if they're standing on public property, like the sidewalk or the boulevard area, the police would just shoo them away. Is the triage center going to be something where if someone is like ready for a detox situation, are they going to bring them there and keep them there?
It's possible, yes.
That they would, because that's part of the problem is I think people are concerned that they're just moving from this house 2 blocks to the next house in the same night. So there's a concern that we have to have a place to put them. And so that's the other thing people want to know. Triage Center is going to have like a holding place for someone who would be very intoxicated.
Did you want more answers to that?
So there will be, or there.
Well, I would say that there are individuals that would be really great candidates for, whether it's police or through EMS that are responding to a call, for them to be able to have that person diverted to the triage center. I think there are circumstances where that would be very appropriate, absolutely.
Councilor Erickson.
I want to talk a little triage here as well, since we've been going on this. This is about mental health and mental illness. It's about detox. It's moving detox from one place to the other. And so mental health and mental illness is a huge problem in our community and nationwide. We can't just stick our heads in the sand and say, oh, somebody else is going to do it. And so the fact that this group has been meeting for 3-4 years now, it's evidence-based. They've received tons of money for grant money. The fact that two competing hospital systems are willing to sit at the table and fund something along with the county and the city, and the state is looking at us as an example, and we're being recognized on a national platform for the work we're doing in Sioux Falls, is amazing. That is huge for our community, that we're able to put these balls in motion. Many of us have traveled to some other, Vegas, Miami, there's 4 or 5 different other places that people have gone to look at evidence-based triage centers. We're not paving the way. We are literally, we're copycatting, making it work for our community that's going to work the best for the needs of our constituents. This isn't just low income. This isn't just homeless. This is for everyone. This is for our city, addressing mental health, detox, you name it. There's a slew of things. One of the low-hanging fruits as we started our conversations, as you know, I served on the leadership team for a while, was moving detox. That was recommended from Travis, our consultant, that said, hey, why don't you move detox out of the jail? Because they're not criminals. These aren't criminals. It's like telling a non-Christian to go to church that they feel like they're going to start on fire when they walk in the church. This is about a safe place for them to get the help that they need. And so moving that detox center is just one of those low-hanging fruits. And so it's literally transferring the money from Chief Burns' budget to Director Franken's budget under that triage umbrella. So at first when I saw it, I was a little confused going, what are we doing here? I don't remember this, but it makes full sense now for that. And again, I really, really want to address the fact that 2 competing hospital systems that are willing to sit down and say, we want to work together. We beg you as directors and other elected officials to sit across the table and collaborate. This is collaboration. We've had so many players, from judges, police, fire, I mean, you name it, in this room, talking about ways that we need to even change state laws. The work isn't done yet. It's going to take some time, and there are some state laws that will need to be changed too, but this is amazing for our community, and so I hope that you all will support that. The other thing is we negotiate contracts all the time. When I say we approve them, you negotiate them, whether it's the golf contract, the EMT, SMG, the pavilion, we're negotiating contracts all the time. It's just not 2 months before the contract's up, we better renegotiate that. You're constantly monitoring those, and with that RFP process, it's not going to be done on a whim. The intent too, as we've traveled around the nation looking at some of these places, is that this will benefit the hospitals as well, in hopes that some of the folks will not just run into the ER for assistance, but they'll get pointed help that they need. And so we have seen in other communities that Las Vegas, for example, the hospital systems have embraced it because in the end it helped their budget as well, from keeping somebody that doesn't necessarily need to go to an ER. So keep educating yourselves on it. Keep coming in front of us. I don't want to just talk triage because we're talking your whole budget. So I'll say thank you for your presentation. You do a lot of amazing things. I think there's a lot of exciting things that we haven't even touched on today, but appreciate all that you do for our community and making sure that we are getting access for healthcare. Thank you.
Councilor Sale.
Thank you. Thank you, Director Franken, for your presentation. Sure. When do you expect that these contracts, these agreements with the triage center, the hospitals, and the county, when will they be finalized?
We're hoping that the governance structure will be in place in October, which would include then the agreements that go along with that. So we're aiming for October.
Would you make those available to the council for review?
I believe that would be, yes, absolutely we will.
Okay, thank you.
Yes.
Anybody else? A couple of quick questions. The 3,300 patients screened for depression, what initiates that? When somebody comes in, do they diagnose or ask for this, or do people go, you might need to, what gets you in that direction?
Sure, put my clinical nurse hat
Right.
on here, yeah. So a person, it's really a high priority for health centers to be able to assure that we have identified people who have some form of mental illness or addiction issues. So we have some screening tools that we initiate for all adults. There's a couple of questions around addiction issues as well as for mental health that we ask, and if they screen out that they are, at risk, then we do additional screenings with them, and then we refer them into care as appropriate. And so that's what you're seeing there, where we aim to get those would be the ones that have screened out and then follow-up has been initiated for those individuals. And so that's a process we use, so it's a really high priority for us in the department. And it kind of goes to what Councilor Erickson was saying, that it would be, sometimes we make certain assumptions about where someone's at with their mental health, and it can get overlooked then when someone has a mental illness or an issue that they're dealing with. And so it's really important for us to just treat everyone the same that comes into our clinic. And really, every clinic should be doing this as well in our community. And many are working towards integrating behavioral health in their primary care. And so really it's incumbent upon us to really know, just like we're checking someone's blood pressure, just like we're checking their TAMP, we're checking their BMI, things like that, we should also be checking for their mental health and whether they're at risk for substance abuse issues. And so that's just a priority that we have of our clinic now. So thanks for asking.
Yeah, well, amen to that. That's just kind of wanted to put that number in perspective. You almost think it should be higher. But I don't know what triggers that. But thanks, good answer. That AARP program that we got that designation. What exactly? Can you remind me what's entailed, and is there a cost to anything when we're converting something to be a part of that, or what was that?
No, there's not a cost unless we decide to employ certain best practices or initiatives. Then we would, then that could be something that we would probably bring as a budgetary item. But to be part of the network itself does not cost anything. And so that is something that we were able to gain as providing the application that showed evidence that we would be, really serious partners in the network. And so we were approved to be part of it, and so it allows us to access those resources, which will have some value to us at no cost.
Okay. Well, thank you. Thanks for the presentation.
Yeah, thank you.
All right, up next, we've got a presentation by our fire chief, Mr. Goodroad. Welcome.
Good afternoon, councilors. Fire Chief Brad Goodroad here to present our proposed 2020 budget for Sioux Falls Fire Rescue. I want to thank you for the opportunity to present today. Also want to thank Mark Bukovich and Jeff Helm from Sioux Falls Fire to help put this budget together, and then everybody with finance on that entire team. Very collaborative environment there to get us to this point. So I'd like to first start out with sharing the video on our story. Sioux Falls Fire Rescue is committed to protecting the people and property of our community from hazards and emergencies through education, risk reduction, and emergency response. We are taking care of today for a better tomorrow. Sioux Falls Fire Rescue's mission statement and values are well represented in the priorities of the department and its members. In 2019, day-to-day emergencies were handled effectively, along with education and community involvement efforts with a goal to reduce risk in our community. Maintaining an accredited status and an ISO 1 is an ongoing priority, and Sioux Falls Fire Rescue underwent the extensive accreditation process through 2018 and completed in 2019, with the Commission ultimately awarding reaccreditation to Sioux Falls Fire Rescue. This continued self-evaluation and improvement model leads to outcomes and programs that benefit the community and meet the priorities, mission, and values of the department. An integral part of taking care of today for a better tomorrow is planning for the community and department needs. Planning for infrastructure requirements now and into the future continue with the design of the community's next fire station number 12, located at the corner of 41st Street and Faith Avenue in southeast Sioux Falls, with the planned construction in 2020 and opening in 2021. Protecting people and property from the risk of fire, medical, and other emergencies requires properly located resources and equipment to meet the demand. In order to take care of today and into the future, the training needs for public safety had to be addressed. Planning, teamwork, and leadership throughout the city has provided a framework for designing a prudent and effective public safety training center that the community can count on to provide its fire and police teams relevant and innovative training for decades to come. This project will continue into and through 2020 with a planned opening by 2022 to 2023. With the purchase of approximately 100 acres of land in progress just north of the corner of North Sycamore Avenue and 60th Street North, will be home to both the Sioux Falls Fire Rescue and Sioux Falls Police Department training grounds. With a growing, robust Sioux Falls community comes the challenges, risks, and also opportunities. Building Station 12 and planning for future infrastructure, along with completing an identified public safety training center need, is a challenge. Investing in the challenges of today will return a future that ensures the department can meet current and future risks and emergencies. With the support of the Mayor's Office and Council, progress on the Public Safety Training Center project and the construction of Fire Station 12 in 2020 will include the financing through a bond for land purchase, further engineering, design, and ultimately the construction. Responses to emergency medical calls and other non-fire specific call types continue to rise. The all hazards and risk response model that Sioux Falls Fire Rescue follows continues to develop and support the future in areas such as emergency medical services related to advanced life support coverage with the department's first deployment of paramedic staff response units. The all hazards response model also covers hazmat and rescue calls to water, trench, confined space, high angle rope, structural collapse, and wildland urban interface fires. Alternative response models, which could include partnerships with other departments, nonprofits, community organizations, and institutions, such as the hospitals or mental health providers, will need to be explored in order to be successful. Investments in Sioux Falls Fire Rescue and the community will and should be gauged on return or outcomes, and current investments in Sioux Falls Fire Rescue are returning a community with reduced risk, increased survival rate during cardiac arrest, lower property loss when a fire occurs, and an all hazards response model that includes planning, prevention, appropriate response, and recovery. We are taking care of today for a better tomorrow. So Fire Rescue's proposed 2020 budget is $30.9 million, of which $29.5 million is for operating expenditures and $1.4 million for capital expenditures. With this investment, Fire Rescue is able to accomplish the following for our community: maintain an insurance or ISO rating of 1, which we had achieved in 2016, which has a rating scale of 1 to 10, with 1 being the highest. The rating evaluates community risks and the department's ability to respond and react to those risks, with the potential for lower insurance premiums for businesses and homeowners. Maintain a status of an accredited fire department. We're one of only 77 departments in the country that are both accredited and have an ISO rating of 1. Accreditation looks at all aspects of service delivery, including response times, deployment strategies, training, community risks, water supply and infrastructure, and industry best practices. We collaborate closely with Public Works, GIS, and Metro Communications to complete this comprehensive self-assessment. We operate 11 fire stations that are staffed 24 hours a day, 365 days a year, with a total of 208 personnel and 195 of those being uniformed. Operate as all hazards department provided by Urban Search and Rescue, as well as hazmat teams. Conduct over 3,700 building inspections to ensure all buildings meet fire code. Every commercial structure is inspected each year. These include engine company surveys and yearly inspections. In 2018, Fire Rescue responded to a total of 12,800 calls for service, with 6,400 of those being EMS. Here are some of the things that the community gets back in addition to the all hazards emergency response. We have child safety seat technicians in every station, ready to help parents and caregivers properly install their seats, as well as coordinate with the state to deliver free seats to those providing a financial need. Coordinate with Red Cross and other partners to provide free smoke alarms and installation. Provide a wide range of public training, including fire safety, fire extinguishers, CPR, and AED training. We also provide EMS coverage and event support, along with community outreach efforts at several of our large public events. A big part of our success comes from developing excellent partnerships and relationships with other city departments and community organizations. Here's a list of a few of those organizations. We work closely with city, county, and state emergency management. We have mutual aid and training agreements with area fire departments. Work as an EMS partner on a daily basis with Patient Care Logistics Solutions and REMSA. Become one of the first departments to partner with PulsePoint for a verified first responder program. We train and prepare with the school districts for large-scale events. Work closely with Community Blood Bank for our annual Heroes Behind the Badges event. And we work and train closely with Sioux Falls Police Department as SWAT medics and bomb squad members. Ultimately, our community's fire department exists to save lives and property as our biggest return on investment. As a direct result of a $30 million annual investment, the fire department saved 28 lives and $218 million worth of property that was exposed to fire in 2018. Looking at our CARES data for last year, our EMS system in Sioux Falls saved 28 lives of those having a witnessed cardiac arrest. And due to the CPR and AED training efforts in our community, we had 66% of those bystanders initiate CPR and 23% implementing a public access defibrillator. In addition, are those lives positively impacted by the multi-hazard mitigation rescue efforts. Over $1 billion in property was saved over the last 5 years. We're looking at it another way. Of all the property that had a fire start, 96% of that value of that property was saved. We are currently at a 96.3% property save rate, totaling $127.9 million saved in 2019. We have 3 BHAGs in Sioux Falls Fire Rescue, and you'll see we have broken those down into more measurable goals beneath. First being enhanced community risk reduction, or CRR. As fire departments look beyond just fire prevention, there is a world of identifying your community's risks and then taking action to reduce those specific risks. This works across all divisions within Sioux Falls Fire Rescue. One of the main steps we're taking towards this is to create a position as a community risk reduction specialist. We're working towards reclassifying our current inspector position to the CRR specialist with responsibility to utilize data analytics to focus our prevention efforts to areas where they can have the most impact. Our second BHAG is enhancing community engagement and workforce efforts. We have a new leadership in our diversity and inclusion committee, along with several new members, and they are ready to completely rebrand and re-energize our capabilities in this area. And our third BHAG is to see the completion of the new Public Safety Training Center. We're working to stay on track to have a schematic design completed by the end of 2019. Currently working with the South Dakota Army National Guard on how to best set up this partnership with great success for both organizations moving forward. We'll be communicating with counselors over the next few months to update on progress as we prepare for the bond proposal, and are planning for construction to begin in 2020. So the major drivers of our operating budget being wages and benefits, which include the normal COLA and benefits previously discussed by HR, with the exception of overtime, which is truing up costs for actuals. Professional services, with a $21,000 increase for physicals and testing, which are our annual fit-for-duty medical exams. Rentals, which includes a $15,000 technology rentals increase for our desktop and mobile technology chargebacks to the department. This increase is primarily due to the reallocation of the shared charges by all departments. Repair and maintenance is seeing an increase of $78,000 for fleet vehicle repairs. This is based on an increase in rates being charged by fleet and normal repair and maintenance. $10,000 increase for radio repair to match actuals. Supplies and materials has a reduction of $30,000 in emergency response equipment from 2019, which had a hazmat training trailer from the state grant funding. And training has increased $15,000 for CFAI and Pro Board certification and credentialing. In the CIP, you'll see the land acquisition in 2021 and design for Fire Station 13 in 2024. In the OSEP plan for 2020, the only addition will be the EMS response unit for Station 12. This is one of the smaller multi-use vehicles that we utilize to run EMS incidents without utilizing the larger fire trucks to save on utilization costs. The remaining items in OSEP for 2020 are replacement items. Include a battalion vehicle utilized by our BCs as their primary response unit, emergency management vehicle for daily use and primary response vehicle, a rescue fire truck which utilizes our USAR station crew, utility vehicle which is our fully equipped wildland capable UTV, pickup for fire inspector utilizes as their primary fire inspection and investigation response unit. You'll see a hazmat boom trailer used to hold booms for collecting contamination on water. USAR victim location kit is utilized for locating victims in a structural collapse and confined space. Radios for apparatus, station, and portable use. SCBA cylinder with stage compressor, that's used to refill our SCBA bottles after use. Outdoor warning sirens, used during severe weather and tornado. And our thermal imaging cameras are used as a high-tech imaging camera in our harsh environments. So that concludes Fire Rescue's presentation, and ready to Okay, questions?
All right, thank you. Questions? Counselor Starr.
Thank you, Mr. Chairman. Thank you, Chief. I'll start broad and then I'll probably get a little more specific. But first of all, could you tell me roughly, because you did, one of the slides talked a lot about the other things that we get for our money with the fire department, whether it was CPR training and just a list of great activities, fire alarms, fire prevention, things that go with your budget. Could you break down the typical calls for service for us of how many actually fires versus traffic accidents versus, kind of a rough idea of how that breaks down in calls for service?
Yeah, I don't have all that with me.
General is fine.
Right. Your fires, you're in that 200 range, so there's probably about 250 fires that you'll see a year. And then the medical calls are a little over half of our calls, our medical calls. When it gets farther breakdown than that, I need to literally get that to you.
No, that works. The other, you talked about accreditation and the expenses of training and going through that process. Tell me why it's so important for our community to have ISO certified fire department. What does it mean to our residents? Not only what it means for your staff, but just give me that general why it's so important for your department to be accredited by a national organization.
Sure. Accreditation is a third-party view coming into your department, and they look at everything that we do. And they look at best practices, they look at our response time, and one of the biggest takes out of that is when they look at our response time, we're able to utilize those response time models into our ISO rating. If we were not able to do that, ISO would require to get to a class 1 fire station every mile and a half, which is impossible. So they kind of tie together in that manner. We use the response time data from our accreditation and then into our ISO. And then in ISO, the higher class you get, or the lower number, the better your insurance rates are. So they affect businesses as well as homeowners. When you get to a class 2, that really improves your homeowners insurance. When you get to a class 1, that starts to affect businesses. But it's very hard to put an actual number on what that is for a community because all the insurance companies do things a little bit different. There's no real center database that has all those things brought together, and every community is different. And even within certain insurance companies, certain businesses might have different things that they need and don't have, so that can affect their rating. So there's a lot of things that affect it, but it is known that as that rating gets better, the insurance rates go down.
I'll give my colleagues a chance. I got one or two more, but.
Anybody else? Counselor Staley?
Well, first of all, Chief Goodroad, I have to say that I never hear anyone saying a disparaging word about our fire department.
Thank you.
So there's a fire, there seems to be great satisfaction with how your department is operating, so that's really positive. When we're coming back to that safety center, again, we're not getting any real hard, fast numbers on this. 20, am I right? It's 20 to 30 million, perhaps?
Right.
And Councilor Starr, are you going to touch on other funding sources? Okay, I won't go there. But once again, making sure that we're showing our citizens that we've utilized all the funding available outside of our tax base is, I think, really important. I also think it is important that we would work to incorporate other entities into the functionality of this thing. Like, will the county be using it? Will the state be using it? Will they?
Well, the fire departments in the county will certainly be able to utilize it, and it's going to be my primary task over the next couple months here to really identify that and communicate to this council on what we're looking at, what partnerships we're looking at, what works, what doesn't work, and really make sure that you're informed on what this is.
Because right now, I did do a tour of it a few years ago, and my understanding was that we do have these other governmental entities currently using the shooting range and not, of course, burning down buildings out there, but it is being utilized by other governmental entities, correct? So having them part of the in other municipalities, having them help to pay for this thing would be really an appealing energy for our citizens, I think. The bonding thing, you know, once again, we're kind of in flux right now of a petition drive, talking about how that bonding mechanism is going to move forward too, as far as what threshold you're going to need from the city council. So just keep that in mind. I'm going to bring something up here. It's going to be a little not contentious, controversial perhaps. But Jolene Letcher, when she was running for mayor, she brought up the concept of precincts throughout our city. And of course, it was shot down. And now I think it's being floated around and maybe under some different terminology. But as I've been hearing concerns about our community of safety, it's come to my mind that it would make sense to partner with the fire department throughout strategic places in our city and have some kind of a police presence within a fire department facility. And now we're building a new fire department. How easily could that work within a fire department?
Yeah.
A building.
Sure, it's planning for it, and we've had those discussions, and it's the report to work piece that you're talking about for PD. So in Station 12, the way they're designing that station to be on the property to allow room to expand for that exact thing. So we're not building it into the design or into the design of the building itself, or for the construction next year. Simply designing it on that piece of property so that it will fit, so that if at some day that is a point where they want to have a report to work, it'll fit on that property.
But let's come back to an existing fire department. So how could that work if we decided we want to put a few officers there that would just be stationed there, so they would be more in the area throughout our community?
We have had several discussions with that with PD. It depends on the station. So some stations and the property they're on are designed where they could accommodate that, and others would be very difficult to accommodate that based on the square footage of the lot, what's already there, parking, how the building is designed. So, it's definitely possible.
Are most fire departments built out of brick? Am I right in thinking that that's
The fascia would be brick, yep.
so? There would be a possibility of maybe doing an add-on.
Yeah.
So if there were designated areas where we said, you know, we need to have something more stationary here.
Yep, and we've looked at that with Station 11, Station 4, Station 6, some of those different possibilities, and looked at how that might fit on that piece of property as a future endeavor and partnership there.
And I just, from what I experienced with the public, I think if we did go towards something like that, there would be huge support from people to fund that. Because again, we're growing, so kind of want to be thinking outside the box on how we keep our citizens safe. But again, thank you for what your department's doing with the fire prevention, I think, and taking care of the fires that happen.
Thank you. Councilor Neitzer?
Chief, do we ever charge for rescues? You know, for example, you know, there's some things where, you know, there's, in other regions, there might be, if you go up a mountain and you're not supposed to, you know, as a penalty, they'll charge you for it. You know, for example, we thought about charging people if they fall into the falls.
We have not charged for that. There is some charging that happens with a hazmat spill. There's some responsibility there. But on the urban search and rescue side, we have not.
Okay, so we don't have any, we don't do that.
We don't currently have anything in place that does that.
Okay, that was just a small question. My larger question is, I'm glad to see the community risk reduction and then to see the words enforcement and prevention, and that leads me to a question where I'm not going to go into the details of it, but I have at least 5 departments working on this right now, and you're probably aware of it. Publicly, well, let's talk about fire hydrants. The city flushes their own fire hydrants. Do you inspect those or check those for water pressure, or is that just really on an as-need basis? Let's just start with public fire hydrants.
The water department handles that.
Okay. Now, At a commercial business where you have that connection point, that public connection point, which I'm assuming is so you can plug in for firefighting, like at Hy-Vee, is that something that's ever inspected on a routine basis when your inspectors go out to make sure it's functional and that there's sufficient pressures or?
Yeah, I believe that's tested annually.
Okay. Now, going into the private area, let's say trailer parks, the fire hydrants there, does anybody inspect those?
We have not been currently inspecting those. They're a private space and a private thing. And through some recent things, yeah, we're looking at that, and the code is providing us the ability to require that.
And would you need more staff, do you think, to do, whether it be annual or, to be able to do something where you could inspect that? Because there could be a significant number. There's a lot of trailer parks in the city, very large ones too.
Yeah, we're in discussions right now with the water department, fire department, planning and development services to kind of figure that out. What's our best course of action on doing that?
And is there anywhere else in the city that you can think of that would have private fire hydrants? Is there like apartment complexes or large?
Some apartment complexes. I can't be real specific here, but trailer parks, and there are some apartment complexes that ended up with a private system, and that's from annexation that's happened 20, 30 years ago. And when that was annexed in, it was private, should have been handled at the time, how that is, but it apparently hasn't been, so that's something we're looking at now. And it is, whatever decisions we make on this now is big, because there's a lot of different places like that, so we'd have to fairly implement whatever we're going to implement across.
Okay, well, we'll continue the discussion, but I will be a strong advocate for making sure you have funding to make sure that we get that for prevention, life safety, and protecting the tenants.
All right, thank you.
Thanks.
Councilor Sale?
Thank you. Thank you, Chief Goodroad, for your presentation. I just have a statement. I'm disappointed that the new fire station has been moved into the bonding structure going forward. As we go forward, it's always a question whether bonding is going to happen or not going to happen. So if a bonding issue was to fail, I would suggest you be prepared to find that money for that next fire station.
Very good.
Anybody else? Councilor Brecky?
Question about your, I think it's your second BHAG, enhanced community engagement and workforce efforts. Can you just tell me a little bit about what you've got in mind in that goal? It's general, and I'm very interested in it. I'm excited about it, and so I want to just hear a little bit more what what your thoughts are about engaging our diverse population, or our growingly diverse population, and how you're going to do that through the fire department.
Right. As I stated in there, we have a new leader in that group. They're very excited about the opportunities. I think we first need to make sure we educate our internally, so we understand what diversity and inclusion is through our own members, and then gain that acceptance and then move out into the community. I think there's lots of different ways that we can recruit and get that message out. One of the things that I think is very important for us to do is when we do our public education in schools, that we provide some of that education, some of that acceptance, what that is, and that this is the job everybody can have. Here's the things you need to do to be able to be a firefighter. Plant those seeds very early in our diverse populations in the schools. And when I mentioned this community risk reduction specialist, that's one of their responsibilities is going to be school education. Revamping what we're doing. We've kind of done the same thing for a long time. It's time to really take a look at that and see what else we're doing and what we're missing. So I'm excited for that opportunity for that individual to take us to the next level there.
Thank you.
Anybody else?
Yep, if I can.
Yeah, Councilor Starr.
Thank you, Mr. Chair. Kind of a follow-up a little bit on Councilor Sale's statement. When did we decide to move from paying cash for the new fire station to bonding? And it might be as much of a finance question, because obviously that freed up a lot of capital money by moving it out of the capital plan and paying for it with cash. So I guess I'm trying to figure out what we got instead of paying cash for the fire station and the long-term bonding that goes with it versus what we're getting for other capital choices that we made?
I can probably start to answer that, but I think it would probably be better if someone from finance would answer that question for you, if that's all right.
Sure.
I think it's as part of, as we were going through the capital program and trying to differentiate what the priorities were and the requests that were coming from the departments, certainly the priority and what we were hearing a lot from the residents and the community and the whole process we went through on the budget was commitment to road and infrastructure. And so it was really looking at what we could do to be able to enhance that commitment to that as part of the near term for 2020. So, and as we looked at that bonding request and how much we would have available with that, we felt that we could incorporate the fire station as part of that because it is a long-term asset that will last us over 50 years. You know, so we felt like it's something that fit more with the bonding request if we were to free up some capacity there.
But on the reverse of that then would be the way for me to explain it is that we're bonding long-term for streets then instead, so additional street projects.
I guess it's
Right, and that's where I guess, I mean, if you look at it from the opposite direction, we've taken that money and now we've long-term for streets to include that in the bonding. So that answers that question. Thank you. I appreciate that. Chief, I'm going to do my 15 seconds, I promise. Our new public safety training facility has to be a partnership with the region. We have to lead the region and include the communities around us just as much as we train the people who are on our staff as a city. That's our commitment. People from the region spend their tax dollars here. People who live outside of the city buy groceries here. They buy cars here. They buy it through the community. And we need to make sure that we're a leader in this. And our taxpayers of Sioux Falls can't be the only ones to pay for this facility. So I'll stop there because I've gone longer in other times. So I appreciate it. Thank you, Mr. Chair.
All right, looks like that's it. Thank you very much. Next up, we've got Chief Burns. Welcome.
Change all my pages. I got all organized.
Councilors, Chief Matt Burns from the Police Department. Along with my fellow directors, I also want to extend my thanks for the assistance in the budget process to Director Pritchett and his staff. Sam Stanforth is our analyst. Just an incredible job done to assist us in a preparation. It was a different process this time. We looked at it differently. We were asked different and new questions, and frankly, they challenged us in new ways, and I think we all ended up better for it. So I appreciate the process. I'd like to start off, as my counterparts did, with a video from our department.
Community policing is a phrase often used around the country to highlight police engaging with citizens. The Sioux Falls Police Department does not just talk about community policing, we embrace it. This is not a new concept. We have had officers engaging community members for decades. While some of our events may be similar to others around the country, our events have a definite Sioux Falls flavor to them. Officers meet and spend time with different neighborhood watch groups, fostering relationships and strengthening the ties between police and citizens. We rely heavily on citizens to report crimes and suspicious behavior. Those participating in neighborhood watch groups have a stake in keeping their neighborhoods safe, which leads to people calling the police. Coffee with a Cop has taken place in Sioux Falls since 2015. This is an opportunity for people to talk to an officer on whatever topic they like. Conversations have ranged from neighborhood problems, questions about police activity, sports, and even the weather. National Night Out has grown over the years and is a great event where people can get together and learn about their neighbors. Neighborhood officers stop at each event every year. There are several events designed for underprivileged kids to have a positive encounter with officers while doing something fun. Whether it's Christmas shopping, riding go-karts, or fishing, those kids have an opportunity they may not otherwise experience. Our Community Ambassador Program is a new program developed to help improve community relations. The ambassadors work closely with our community resource officers to promote a greater sense of community and unity, reduce crime, and assist in providing a higher quality of life for the whole community. Whatever the event, starting conversations and making people and kids feel more comfortable around their police department is always a good thing. Getting officers out of their police cars and interacting with the community has a tremendously powerful effect. When officers and citizens work together, they are more successful in identifying ways to enhance the safety of our entire city.
Thank you again for this opportunity to discuss our 2020 budget. In this discussion, I will relate those items we have identified as a department priorities for the next year and illustrate that we are in step, as well at the police department, with the philosophy of taking care of today for a better tomorrow. From our investments and current priorities to items we identified and promoted through the request for results process and our BHAGs, I hope you will see that as we go forward into 2020, we continue to be well positioned to ensure the public safety of Sioux Falls and continue to emphasize our community policing approach. We are committed to keeping up with the growth and maintaining a high level of service to every citizen of and visitor to our city. To begin the discussion, I will briefly review a snapshot of some key metrics in our department. Our current authorized strength is 269 sworn officers and 37 civilian staff at the Law Enforcement Center. Additionally, we have a number of civilian parking patrol staff at City Hall, which will be covered by Matt Nelson in a separate presentation. We ended 2018 with an 8-minute and 22-second response time to high priority calls. We had 38.8 Part 1 crimes per 1,000 population, experienced 6.3 injury-producing accidents per 1,000 population, and have a 72% clearance rate for Part 1 crimes, which compares to 45% for the rest of the nation. And in total, our department responded to 122,771 calls for service last year. This next graph illustrates the trend lines for our service calls with data going back to 2014. Two things as you look at this stand out. Certainly that our calls for service are greatest in the nicer weather of the summer, which we would expect, but overall, the overall call numbers are steadily increasing as our city grows. The next graph illustrates the growth of our calls for service volume compared to the growth in the population of Sioux Falls. In past years, overall call numbers, calls per officer, and officers per population have proven to be effective metrics in projecting future staffing needs at our department. Those metrics continue to be instructive and show us that over the last 10 years, these rates have grown at an average of just under 2%. To keep up with this percentage growth in yearly call volume and officers per population, it will require us to add to our sworn ranks again in 2020. And we will get more on that a little later in the presentation. But first, a word about goals. Pardon. Council, as you are aware, each city department was challenged to identify specific BHAG goals, ones that were big, innovative ideas that we felt were truly needed in our city and that we believe could really move the needle in an area of specific relevance to our mission. At the police department, we identified the need for a community resource officer program with specialized training in the areas of mental health and addictions. We've heard a lot about that today, and we realize that there's a space for us to operate in that arena as well. So as we continue to see the societal problems associated with mental health issues and crime associated with narcotic drug use in our community, it made sense for us to propose a position with a direct responsibility to build relationships and rapport with persons who are in the midst of addictions and mental health crisis. The idea is to work on positively impacting the outcomes of the mental health and overdose calls that we go on routinely. This officer would also be our primary department liaison to the newly formed triage center when it opens, and also assigned as our department representative to the new mental health court that is now being formed in our district. As overdose and mental health calls continue to grow, along with suicide calls in our city, we believe that this will have a real and tangible effect and be successful in Sioux Falls, just as it has been in departments across our nation. So getting to the budget breakdown. You can see that the largest budget impact for items projected in 2020 are the 4 new patrol officers, as well as the mental health and addictions community resource officer. This does amount to about $396,000 of our overall increase. Again, these 4 new patrol officers are needed to keep up with the growth of calls for service, population, and to manage response times responsibly. The next largest budget driver is overtime considerations at $250,000. While this does look like a large number, $120,000 of this represents an Office of Highway Safety grant fund increase, which we will be receiving in 2020 that is budget neutral. The remainder of that amount is to offset the actual overtime cost experience we have been seeing to maintain shift minimum staffing levels, overtime costs associated with emergency call-ins across the department, and overtime needed to support the many scheduled special events we have been tasked to staff as a department in an ever-increasingly challenging security environment. These events are such as the Sanford International Golf Tournament, Jazz Fest, the Air Show, parades, the activities at the Levitt, and the First Friday activities, and others. The next item I want to talk about in our 2020 budget includes a $270,000 or 25% increase in the city's commitment to Metro Communications. Metro Communications, as you know, plays a vital role in the Sioux Falls public safety system. After an extensive review of Metro Communications operations, which included representation from the city and Minnehaha County, it was evident that additional resources were necessary in order to support not only the increased call for service volume from a growing community, but also the increased number of city and county public safety workforce personnel. This increase will fund 4 additional Metro operators, employees, and begins to fund a more consistent approach to adding personnel going forward. The next item I want to speak to you about is our proposed report to work location. So in addition to adding patrol officers, we are projecting to keep up with the prominent city growth in the southwest part of our city by proposing to lease building space in the southwest portion for a remote police report to work location. At an estimated cost of $62,000 for the lease and the $50,000 for light remodeling to make it an appropriate police space, this will allow us to reduce the commute time for evidentiary and administrative purposes for officers going back to the law enforcement center on a continuing basis. Leasing also provides an opportunity to review successes and maintain flexibility for the future. As our city continues to grow, this is a necessary and responsible initiative. So, next thing is a cybercrime analyst collaboration. Earlier this year, discussions started between our department, the South Dakota Department of Public Safety, and Dakota State University for collaborating on a digital cybercrime analyst position to provide dark web threat overwatch for the state of South Dakota and the city of Sioux Falls. Our interests in this area include criminal investigative support to my detectives of my department in the areas of dedicated denial of service attacks, identity and credit card theft and fraud, narcotics trafficking, and internet crimes against children investigations on the dark web. This is truly an innovative approach that would place this analyst, which is a state of South Dakota FTE, in the Fusion Center located in Sioux Falls. The position will be supported by $30,000 each year from our police budget over a 3-year period and addresses a real and dangerous gap in our ability to uncover, mitigate, and investigate threats and crime occurring on the dark web. This area of crime is growing daily, and this collaboration puts us in a solid position to address this threat. So moving on to the capital overview, you can see that our department has no items currently in the capital schedule. However, we do have many items in the cyclical OSEP schedule. The bulk of these items continue to be primarily life cycle replacements. Broken down further, these include 4 sedans, 2 of which are for Protective Division and 2 are marked sedans for patrol, 1 3/4-ton pickup for our animal control team to replace one that's being cycled out, 2 police motorcycles, 1 marked crossover for a replacement canine unit, and 14 marked crossovers for patrol units that are being cycled out. In addition, on the equipment side, we have technology items such as a Homeland Security grant-funded drone, police radios, continuing to replace those on a schedule to get us compliant with the state P25 standard, both mobile and for the cars, 2 bomb disposal suits to replace ones that are past their due, and video technology, which amounts to storage space for patrol car and body cameras. That rounds out the most significant of our 2020 capital expenditures. So council, I would say in conclusion, at the police department, we do understand that we must continue to innovate and find creative ways to address issues in our community. Our first and foremost priority is the protection of human life. This and the protection of citizens' property are fundamental pieces of our mission to promote a safe city and a strong quality of life that we all desire. We believe that this budget proposal is a forward-looking and responsible plan that gets us there. So with that, I would be happy to take your questions.
Thank you. Councilor Erickson?
Thank you. Thanks for the presentation. Thank you to the whole police department for what you do to keep us safe. I know that the department's been talked about quite a bit lately, from increased crime on the east side, and doing the town hall was, I think, the right step in the right direction to being able to engage and hear citizens. So thank you for all of the officers that do work so hard to protect each and every one of us. My question is, two brief questions. The report to work site pilot. I certainly understand the desire to lease space. So we're looking at about 110 grand, 112 grand a year to do that. And the only reason why I'm bringing this up is because as we've had the city center debate, it was ingrained in each and every one of us that leasing is bad. We're going to get rid of all of our leases. And I understand we're in a different administration and different directors, but the idea was no more leasing. We're going to centralize. And I know this is a little bit different, but do we have any facilities anywhere that can be retrofitted for a pilot program for that time being, whether it's a community center? Certainly don't want, it's not a place where you're putting criminals and things of that sort. We don't want, if there's guns for evidence, we don't want those next to the schools. I get all of that, but is there some sort of location or some partnership, whether it's the state, the county, or even the school district, if they've got a location, that can be utilized versus just going out and leasing again?
Sure, and I do appreciate that question. In fact, so we are looking at the southwest part of town because there's for two specific reasons. Our experience tells us that that's one of the fastest expanding parts of our city, and we had a study, if you recall, done by a professional consultant that said it is the southwest part of town. When you look at your response times, the time it takes for officers to not only after their shift to get out to that area of town and then to come back, and you waste a lot of time in the meantime, and also transporting evidence. So we do have an evidence facility right now in Station 4, what the fire department have for some years, but it's not a full range facility that's appropriate for all matters of evidence. So that was also referenced in the consultant report. We have looked at a number of facilities out there in the Southwest. We have not found any that's appropriate space for what our needs are. There's security needs, there's evidentiary storage needs, and frankly, it has to be in a spot that has really good access for quick egress and ingress for officers responding to emergency calls if they need to. One of the other issues, and thank you for bringing this up, Counselor, we have looked with the fire department spaces at Station 4 and Station 6, and frankly, when those were laid out, they were laid out for the space that was needed at the time and for the number of vehicles and police officer vehicles that we would need to have there, as well as parking of officers' vehicles as they're coming to work. It just doesn't give us sufficient space and a footprint and still have the number of building square feet space that we would need. But we did look at those, and we actually asked our consultant to look at those, and they just haven't proven viable. So for the future, we are looking to collaborate down the road with Lincoln County on a more, I guess, brick and mortar facility and in conjunction with their needs, but that hasn't gotten off the ground yet. I need to move now. I am just scratching for space at my law enforcement center, in my parking lot, in my locker rooms, and in my employee working space, so I can't afford to wait on a process that may be 2 or 3 years out. I need to act now to be and have responsible leadership on this issue.
And I get that, and I don't mean to be snarky with my comment. It's just, for so long, it's, as we kind of walk through that debate, it was, we want to get rid of all of our leases, and then now we're bringing on leases again. But I do understand your desire, and I do support that need. If we can move on expanding a fire station in the future or something like that, that just might be another option as well. The last question, then I'll stop for now. Video technology storage. You did mention body cameras. Is the department moving in that way, or where are we with that?
So we have part of that storage is for the body cameras, and we currently have 30 body cameras that are on a GTAC system, which is the same system we have in our patrol cars. We went to a modular system, so one company would have the same technology, upload and download for the videos. Those 30 cameras were purchased, if you recall, from our discussions before, to plug a gap where, and I gave them to officers such as riding a motorcycle, riding a bicycle, on foot patrol, my SROs in the schools who had consistent trouble getting a signal out to their vehicles to actually start the systems. And so all my other officers in my patrol vehicles have a video system with remote audio recording from body mics, but I had a gap to plug. And so going forward, we have looked at purchasing body cameras for the rest of the department. I have an estimate that's about $550,000 to buy the cameras and the storage space for a 5-year contract like I have now. I recently looked for a grant to assist with that purchase, and the best grant I could find at any level would cover about half that cost. So knowing that I had a little over $200,000 to make up, I had to prioritize. So the things you see in this budget were prioritized because things that I need now, and you may well see that an RFR or something approaching that to support that cost for that body camera in the future. But I will say that this is also going to come with an FTE cost, because when you bring on an entirely new video stream for the rest of my staff, there has to be a way to appropriately manage that video for evidentiary purposes. Right now, the state's attorney's office does that. The Minnehaha County State's Attorney's Office does that. But if I bring on a whole another video stream, they're not going to like me very well. They're going to ask for help. And we've already had those discussions. So in addition to the $550,000, we're probably talking a couple FTEs just to manage that huge amount of video stream and to do it responsibly. So it would be difficult for me to look at any counselor or any citizen and say I need FTEs to manage video and not take calls on the street in a growing city. So that's some of the things we're balancing.
Thank you, I appreciate that. If I can do one more small one, I'm going to piggyback off of Councilor Kneitzer's question to Fire Chief Goodroad earlier. Are there cost recovery measures that the police department does for rescues or whatever it might be, other than, I know if somebody has an alarm system and it goes off and there's not a need and it's malfunctioning or whatever, and you have to keep going back to that location. I know that that can be cost recovery, but other than that, are there any other areas in which you would charge? We see a lot of rescues and things where both fire and PD have to respond to that take a lot of resources, which I understand are the tax dollars, but when you're not supposed to be jumping in the Big Sioux River at Falls Park, and we see it almost weekly, is there anything that we can do to assist that?
Yeah, we typically haven't taken a cost recovery approach, but we're always open to that possibility. And if there was a significant event that by any standard that our citizens would expect some sort of reimbursement, we would gladly contact the state's attorney's office to start that civil process. But as a standard matter, of course, we don't have that in place now.
Thank you.
Councilor Kneitzert.
Yeah, and just tagging off of that, the reason I brought it up is I'm just always thinking about deterrence. Never going to stop everybody, but just thinking about that. Sounds like you answered my body camera question. Very, very detailed and very good. Appreciate that. And I would say there are times where it's appropriate to lease, and I think in this particular case, being able to be nimble and not be pinned down is probably not a bad thing. So I think that's a good thing. You had listed in your OSEP patrol vehicles, and then you just listed sedans. Are those sedans not patrol vehicles? Or are they some other just general?
Yeah, so there's 4 of them there listed. 2 of them will be a regular sedan for our detective vision that use those vehicles for surveillance and things like that, and just a normal course of their duties. Those won't be marked. The other 2 are intended to be marked sedans for patrol use.
I remember an officer telling me that they preferred the crossover just because there's more real estate in there with all the equipment they have. Have you moved, is it pretty much exclusively now to purchase crossovers for patrol or is there still some of those interceptors being purchased, if that's what they're called?
The vast majority of them are the crossovers just for the room that you mentioned. And in fact, Ford's going to stop making the Taurus platform. So in the very near future, we won't have a choice. They'll all have to be a crossover or something like that if we stick with the Ford product.
Okay. And the last thing, just a statement, which I really appreciated the discussion we had Friday morning where you explained the hiring process and that we all want more officers on the street and we want it yesterday, and that there's a very lengthy process that we have to go through to get the officers trained, several weeks and months with us, and then they have to go to the academy, and the state only has classes open at certain times, and we have to wait for that, and they get done with that, and then they have to go through ride with the field training officer for 8 months, I think it is, something like that, before they're cleared and they're completely on the street on their own. So it's a well over a year process, assuming that we don't have people that get halfway through and decide this is not for me, and all of those things. And so it's we're working as fast as we can to get more police on the streets, but it does take time, and that perspective, I appreciate it, and I wanted to share that with the public, that you're working as hard as you can, but there are gates you have to go through. When you're going to be an officer in a city this big, we need people that are properly trained so that they do the things the right way for all kinds of reasons. So I appreciated that.
Thank you.
Councilor Staley.
First of all, I just a word about the leasing element. When that was coming up with the administration building, which we're now calling the city center, but I don't think any of us really were opposed to leasing at the time. It was just that the former administration thought it was a bad situation. They wanted us to build a new building. So I don't have any problem with you leasing a building to try it out. I think that is a wise decision. And back to the situation of recouping money from people negligently falling into the river, I have been thinking about an ordinance or some signage that would say City of Sioux Falls prohibits swimming, a bigger piece of signage, and then we could have fines will be imposed. I don't know if that's going to be an ordinance or just a policy that we need to implement. Do you know if we have an ordinance that?
Yeah, you can be fined for swimming. There is a state law against swimming in the river, and that's it. But you can't hardly go to Falls Park and from any parking lot not go past a sign as it is right now. There are just a good number of signs that have signage and the words that tell you what the prohibitions are in the park. So you'd be hard pressed to miss that if you're paying attention.
Well, and they have actually changed the signage since this all came about. They've made it down lower and I think a little bit bigger, but that's for another day. Anyway, let me say first of all that I have the utmost respect for the dangerous, challenging job your officers have. And I think everyone in our community understands that. And I personally, as a council member and as a citizen, want to do everything I can to encourage your officers. And that's why when we've had the contract negotiations, I've really wanted to be on the side of giving them any concessions they may need, compensating them well. And my image of, as far as our city's availability to attract people for applicants for jobs, I think we have a pretty good track record within our city as a whole. We got a fabulous benefit package. I think we treat our employees well. I do believe that within the police force, that's one area where we probably need to be offering even more incentives, just to let them know that this is a great place to work. And it's a hard job. It's a dangerous job. So I want you to understand that I support that totally. And I'm looking forward to a ride along with your officers. I know some of my colleagues have done that, and just to really get a better sense of what they're engaging with on a 24/7 basis. That being said, I was having a conversation with two of my colleagues just this afternoon, and one of the things that we have to negotiate as council members is how much do we do with policy, and you know, we handle the purse strings, we get to write ordinances, so it's, you know, we're not supposed to really tell you how to do your job. So I'm not trying to tell you how to do your job, but I am going to make some suggestions, things that I've been hearing from people, especially I'm coming back to that Whittier neighborhood, that I know we have school safety officers. How many of those do we have? Do you know offhand?
We have 15 school resource officers.
And we pay for that.
Correct. Those are City of Sioux Falls FTEs.
So 15. So we're putting those into the school system. And some people would say, I know we're going to be talking tonight about buying some school supplies for kids, you know, with some city funding. People are going to say, well, why are we crossing over? Why isn't the school district paying for their own officers to be there? But they're not. We're providing that. So one of the things that I've been hearing, it's been coming to my mind is why can't we have a school, like a Bishop Dudley safety officer or the Whittier neighborhood safety officer, someone designated for that. I see like a foot patrol primary liaison officer, and we're going to be doing a liaison was it triage center? Was that one of the, you've got an officer who's going to be designated for,
So yes, if
Yeah.
our proposal for a mental health and addictions community resource officer is approved, they would be our primary
yeah,
liaison.
so we're giving someone to the triage center, but I will just tell you right now, from what I'm hearing on these homeowners and the business owners in that area, when we're talking about people who don't feel safe in their homes, and their property values have gone into the toilet, and business owners who are ready to leave the area, I think that's at a point where we could designate some energy in the police force just to be primarily there. And somebody suggested, well, those business owners can hire their own safety people to keep their businesses safe. And they've said, why should we have to pay out of our pockets to be safe? This is something that the city should be providing for us. And I happen to agree with that. So not that I guess I can't tell you what to do, but I'm just suggesting that if you could find a way to logistically put someone permanently there, it would be greatly appreciated. Also, some of the homeowners up there would like to see some foot patrol just designated to that area, because that's one way that we're going to perhaps make this help to make it a safer place. And let me also say that I'm so grateful that you talked about the neighborhood watch at the beginning of your video. You know, you and I met right after I got elected. I love Neighborhood Watch. I've been a Neighborhood Watch captain for 15 years. It's a fabulous program. Last week I was able to go to 9 Neighborhood Watch groups, and I was so impressed by what I saw. These people coming together and caring for each other. And I saw police officers scattered throughout there. I saw some fire department people. So bravo, and I'm with you to continue to make that a very strong presence in our community.
Thank you.
Councilor Sal.
Thank you, Chief Burns. I just want to make sure I heard you right. You talked about body cams. The cost of that would be $550,000 plus 2 full-time employees?
Right, the cost of the body cameras and the storage over a 5-year contract like we have now. And I estimate it would take probably a couple FTEs just to manage that much, much larger video stream appropriately for the evidentiary and court piece.
If the city council was to allocate through the budget process that additional money to your department, is that a process that you could put in place in 2020?
I believe so.
Okay, my second question, I want to make sure I heard you right. You said when you talked about the 4 new patrol officers and one mental health community resource officer was just to keep up with the call volume that we currently have?
Right, the 4 officers are projected to track along with the growth of the city and the projected call volume.
What would the council through the budget process have to allocate to the police department to get ahead of the curve, to drive crime out of Sioux Falls?
Well, I don't know that you could ever drive crime out of any community by just a sheer law enforcement effort or throwing money or personnel at it. And I would offer that even though we have a 269 officer authorized strength right now, we're operating about 9 officers below that just because we're trying to get officers cycled through the system. Councilor Neitzer and I had a great discussion, and I went into some detail about why that's the case. So for an example, if the council gave me 10 officers right now and just had unlimited funding, I still have a choke point in getting them certified through law enforcement training and peer, because they hold 3 classes a year. I typically get 8 seats guaranteed to me, but then there's lots of other agencies across the state that need officers certified as well. So I have to get them through peer and get them certified, regardless of how many dollars or FTE authorizations I have. So that's kind of what's throttling, if you will, the system for me right now.
Yeah, I understand that's a choke point. Is there any way that you could take that process over and do your own self-training, be certified, the city of Sioux Falls, and just skip the state of South Dakota?
So state law guides that whole process, and they authorize the Attorney General's office through law enforcement training to be the sole certification body for the state. We do actually about at least half as much time as what they do in peer, or as much time training here. But to get that state certification, no municipal entity or county entity has the authority to certify law enforcement officers, only LET through the Attorney General's office.
Thank you.
Councilor Neitzer.
One more that occurred to me. What is the difference, if anything, between a precinct and a report to work location?
Sure. So a report to work location is exactly like it sounds. It's just a remote place that we have where officers can go. They drive there from their homes or from their residences. They put on their uniforms. They get their work assignments, their district assignments. They get in their police cars and they go out to their districts where their assigned areas. If they have an evidentiary item that needs to come into dry storage or a drying cabinet, they could bring it back and store it in a secure place at the report to work location. So their supervisors who oversee them during the shift and give them guidance are at that report to work location. But we don't track statistics differently in that area. It does not have its own separate command structure, which are typical characteristics you see in a dedicated precinct system like you might find in Minneapolis or a larger city. And so that's largely the difference. What we need and what we've asked for and proposed is not a precinct system because of those distinct differences. It is indeed a report to work location.
Okay, thank you. Anybody else?
Counselor Starr.
Get everything turned on. Chief, help me with the math a little bit of what you were following up with Counselor Sale. Just with, we have 9 spots that are available, normal turnover plus adding the 4, the math isn't working in my head that we're going to be able to get to full force in 2020.
So when I say that, we are about 9 officers short of our authorized strength.
Correct.
Okay? So your authorized strength number and getting to that number is a continually moving target because you can only have so many officers in training at one time, and you continually have folks that are retiring. They might move and take another spot. So it's a continual moving target. So when I say we're 9 short of our authorized strength, I could hire 9 more people right now to get to my authorized strength, but I don't have the space to put them through the training cycle, and that's out of my control.
I apologize, I didn't mean to interrupt. So then my point is, if we're adding 4 new spots for you, we're still not going to get to those 4 officers on the street in 2020 because you're going to have normal turnover, the getting them through the training process, maybe possibly hiring from outside of someone that already has the training or an experienced officer somewhere in the process. I get that too, but if we're trying to make our citizens feel better because we're adding more to the force, you're not going to get to the authorized strength in 2020. The likelihood of, if you're at 269 and we add 4 more is 273, we're not going to get to 270. We're not going to have 273 officers available possibly for a short period of time during 2020, but why not add 6 and maybe we'll get partway there. A little more smart alecky than I mean to be, but it doesn't seem we're chasing that curve. Or I don't see how that we're trying to solve a problem by adding 4 new officers, and we're not going to see the effects of that.
I understand, and in the 24 years I've been on the department, we've hardly ever been at authorized strength, so you're always chasing that number. And so I would offer to you that if we didn't project to add those, then we're automatically behind of where we need to be as we go forward. So at some point, we will get those officers on staff. And at that point in the future, we may be, again, behind that authorized strength number where we're at. But you have to keep adding to keep up with the growth of the city, regardless of whether you're going to be able to add them in that next year or not. Otherwise, you're going to get behind, and that has a compounding effect, and that's not good for anybody.
I guess it just seems like at some point we have to negotiate for more than 9 spots. And I know that capacity probably isn't there with all the other that are there, but if we're continually chasing, I mean, it's hard for me to authorize new spots that I don't think you can fill. When we're in a tight budget, how do I allocate that money for those officers that I don't think are going to get filled in 2020?
Well, that's a judgment you have to make. What I would offer is that I've lobbied my peers across the state, both municipal and county, to ask the Attorney General to ask for increased funding to add a 4th class. But that's a matter that has its own dynamic when you get into the politics of peer. No, I'm going to still project for officers that I think we need to keep up with the call volume and the citizens, regardless of whether I think can hire them in that next year or not, because I can't get behind, and I think that we owe the citizens more than that.
I get that, but we are behind. We're already behind, and that's where I'm trying to, like I said, I mean, we could budget for another 10 officers or 15 and make ourselves feel better that we're there, and I've beaten that enough. One of the, just a different direction, I know Chief Goodrow talked a little bit about his diversity committee and some of the things that the fire department's doing. Can you give us a little bit of idea what you're doing to lead the police department in diversifying our, not only our sworn officers, but our civilian employees as well?
Sure. So actually, over the past several years, HR tells us that our police department is actually one of the leading city departments as far as diversity. So currently, we have 9% of our sworn staff reports a diverse background. And we have 11.5% of our entire sworn staff, or 30 out of our 262 officers on payroll right now as female. So I feel really good about those numbers as I look at across a briefing room when we're doing lineup and I see several females and diverse faces in that room. It helps me think, hey, we're getting closer all the time to reflecting our citizenry. And that's a very good thing. That's been a goal of mine for some time. I would love to hire more diverse officers and more females. They bring incredible strength of diversity to our ranks, and that's going to be my intent.
Thank you.
Councilor Staley.
Chief, if we were going to do a little lobbying for you, who would we contact, what department would we contact to add that extra class?
Well, any of the state representatives and senators would have a say, I would believe.
The legislature?
Certainly.
Well, thanks for sharing that aspect. And then, is our police force using the same model as the ambulance service, in the sense that these guys are they just sitting in areas waiting to be called?
So officers are active patrolling in their districts, their assigned areas, and so they are rarely just static sitting.
Well, no, I shouldn't say static, but I mean they're out in they're not sitting in a precinct, they're not sitting in a building waiting to be called.
No, currently we only have one law enforcement center where all operations stem from, where officers get their vehicles and their briefing and they go out into their districts. So no, they're continually out in their areas, patrolling neighborhoods, patrolling business districts and the streets of Sioux Falls. And when they get a call for service, they will go to that area where they're needed.
So, and so how many officers would be like in a 5-mile radius? Or, let me bring that down, a mile. Are there, like, where I live, would there be, there's some people that are just designated to, like, let's say around McKinnon Hospital, they're always in that area?
Well, they're assigned to that area, but understand that given a certain day's call volume, they might get sent out of their area on a priority call. So candidly, Counselor, it's impossible to say how many you have in a designated area at any one time, but Metro Communications knows where those officers are, and they're the ones that are responsible for dispatching them, the closest officer as possible to the call.
But there'd still, I would think there'd still be some officers that are just going to be designated, because how wide is our town? 11 miles? North to south, east to west?
About 78 square miles in total. I don't know the width.
So I would think there's always going to be officers on the outside parameters of our town.
They're assigned to specific districts.
So they wouldn't be leaving that for an emergency. They're going to stay put in that area.
Metro will send them where they're needed, because you might have a whole bunch of officers that are busy or are tasked with something else. And so officers go to the exigent calls when and where they're needed, and that's a function of Metro. They do an outstanding job of getting us where we're needed.
Thank you.
You bet.
Councilor Neitzer.
Last one, I promise. The blue lights that are showing up on the stoplights, do the police, would they have the authority if they are behind the stoplight and they see the blue light and somebody's maybe coming at them and they drive through and the light has clearly been on?
That's precisely what they're there for. They're called tattletale lights, and that's so an officer facing away from the red light can see when that red light changes. And we have a lot of red light runners, and that's another tool that we're testing along with traffic engineers. They've put that up there for us, and in fact financed it to see if that's really going to kind of move the mark in enforcement and hopefully get more voluntary compliance when it comes to red lights.
I'm sure we're not the first ones to have it. I assume this has been done in other areas. You know if it's been tested that it's sufficient probable cause that it holds up, and as far as the ticket will hold up in court?
Yeah, well, the tattletale light does not illuminate unless the red light is on. So it's it's just a back part of that bulb. So it's not like that there's a question whether the light is red or not.
Okay. So
And I'm not aware if there's any judges that have taken issue with it. I haven't been made aware of that.
it's one and the same light? Do you know?
It's directly connected to the switch or whatever that turns on the red light.
The red
so
light, okay.
It cannot be illuminated if the red is not on.
Got it. Okay, great, thanks.
Anybody else? Well, thanks, Chief, for all you do, you and your team, for our city. One quick question. So vehicle-wise, I know they come in all shapes and sizes, but like I think Councilor Neitzer talked about this with you. So crossover is the most popular, the most that we're going to have. What's the life expectancy of a vehicle? And I mean, what's the cost to replace them? Does that variety, does it really range a lot depending on what it's used for, or is there a pretty standard time frame and cost?
So we work really closely with Fleet, and they want us to get about 100,000 miles on those vehicles. We typically get that, and depending on how many shifts it's run a day, in a little over 2 years. And so it doesn't take long for those miles to add up on those platforms, but they're well maintained. Fleet does an incredible job for us, and we have a couple Fleet employees that work right at the law enforcement center. But that is the standard platform. In fact, they're going to change that for the next model year. Ford's coming out with a new style.
What is the cost on a standard crossover vehicle with the standard equipment?
So I think it's about $36,000. I can refer to Sam on that for a specific number, but it's right in that mid-30s to get to one of those SUV crossovers.
And then generally when they age out at 100,000 miles and they've been well kept, we sell those off to or trade them in, or what usually happens on that for?
So they get surplus to the city, but you'll see several of those are old patrol SUVs around because other city departments are using them after we're done with them. But for police service, we do have a certain life cycle because otherwise the maintenance costs can get too high. And I'm certainly only keep the ones that are in the best shape.
Right. Okay, interesting. Thank you.
Thank you.
Good. Okay, next up, parking. Mr. Nelson. Do you have a motion picture for us as well?
I do apologize, I don't have a video today.
Oh, okay. We're ready for another one.
So good afternoon, Matt Nelson, Public Parking Facilities Manager. So in lieu of a video, I just want to reiterate our mission. So we really have two objectives in our mission. One is to create turnover in our downtown business district, and it encourages business and retail activity in our downtown. And then two is to provide adequate off-street parking supply for leased customers, visitors, and employees in our downtown area. And a big piece of that is being an enterprise fund, so we are self-funded. All of our revenues have to pay for our expenses, and so we do maintain our own piggy bank or bank account, so to say, within city government and the finance department. So these pictures kind of tell a story of what we've done in 2019 and what's kind of changing as we go into 2020 for some of our parking processes and systems. And I'll just kind of start with how we manage parking and availability, because it's come up a lot over the last couple years. And if you look in the bottom left-hand picture there, that's a collage of pictures. They're all within the last week. The top two are from the Block 11 ramp, and the one in the top left corner of that, you can't see all the cars that are down the side on the west side of the ramp, but that's the top level of the ramp that would tell you the under levels are full, and everyone had to park on top, and there's probably about 30 to 40 spots open, so well under 10% of our space is open in that facility. That's on a Tuesday morning. Friday morning, exact same time, we jump ahead, the entire top deck is empty. Drop down to the pavilion ramp, that is right off of Phillips Avenue. Time of day is in the morning after 8 a.m. when businesses are typically open and most of our businesses employees are here. You get closer to lunch, you'll see the picture on the bottom right there, full of cars. The whole area underneath the covered deck of the pavilion ramp also full, but the ramp is full on a Friday afternoon based on time of day. And I just show that to kind of visually depict how occupancy changes based on the facility, based on the location, based on the time of day, and they all have a great impact on how we manage our supply at different locations. Another thing then you'll notice is the pavilion ramp on the top left corner there, and it also goes down to the bottom right. We've installed multi-space pay stations at the parking ramp at the pavilion. They've been in for all of this year. They are gateless systems, which are fairly new. It's what we want to go to system-wide. It increases the accessibility for our users, makes it much easier to get in and out of the facilities. And then you've got the option to walk up to the station and pay, or you can use the Park Smarter app, and you can pay for that parking in those facilities with the Park Smarter app. So the Park Smarter app, just touch on that a little. We always intended to bring that app in under the multi-space pay station model that we have at the pavilion. We did that in very late 2018, and there were stickers telling you how to do that on the machines. And at that time, we were also working to implement that system to use on our parking meters. So we were testing that. We had it pushed out probably a couple weeks earlier than we wanted. But we've worked through a lot of bugs in the first few weeks that was live, and now I would say we're doing very well with that app. The reason we chose the Park Smarter app is it directly ties to the pay station and the smart meters that we use on street. And the biggest advantage that I like about it is there's zero cost to the city of Sioux Falls, the parking department, and there's also zero cost to the users to implement that app. That's unique compared to the other apps that are on the market. Normally, if you went to and used, let's say, a Park Mobile or something like that, either the user would pay the fee or the city is absorbing the fee in their costs. We are doing neither of those with this app. And another thing that we're seeing a change in, and I want to talk about the app and its intent, is the use of credit cards. We're seeing that rate increase significantly, which we like to see. It's easier to get our money. We get it sooner. We don't have to collect a bunch of coins. This is the first year we've seen credit cards exceed 50% of our payment options. We were actually at 51% of our payments came in with credit cards, and 49% of our payments came in through coins. And that is just measuring it on our smart meters and our pavilion ramp, but that's the first time we've ever hit that threshold where we've beat it. And we do collect a lot of coins. In July, we've got 325 smart meters, and we also have 4 of these pay stations. We collected 136,000 coins in the month of July alone. So all those meters count individually in each individual coin. So when we go to credit cards, there is a significant reduction in the amount of coins we're collecting, which reduces costs and the number of times we have to empty meters. So how does that fit into the app? Well, the app is all credit card payments, but the usage isn't that high. We have 4% usage of the app, which is what we would expect. It's much easier to jump out of your car and pay your meter with a credit card right in front of you versus downloading an app and setting it up. The intent of that app is to be another payment option, and it really is to help those people that are downtown very often, or maybe they work downtown, or they're just a constant visitor here. So those are the users we would anticipate seeing, and that's what we are seeing in that 4% usage of the app. In 2020, we will also open our new parking ramp. It will operate as a standalone facility, as it was designed to continually be opened as a standalone facility versus a mixed-use facility. It is scheduled to be opened in June as of right now, and that's consistent with the construction manager at risk timeline that has always been part of this project, that it would be a full opening in June of 2020. Once that opens, the projections are still the same, minus the mixed-use partner or developer on site. We anticipate 300 to 350 users in that ramp on day one. That's based on demand previously and currently. And what it will do is, more importantly, is it's going to shift some of the demand in our system. We've had facilities that have had waiting lists for 10 to 20 years. This will level out that demand within our facility. We'll get people that will move from 8th and Dakota near city center to Block 11, and Block 11 and First Avenue will move to the new ramp. And what it will do is it'll eliminate all of our wait lists that we have in our system, and it'll give us the ability to grow and accommodate future growth. So the last thing is the graph, and I know the numbers are hard to see. The intent is not to see the numbers on there, but it is to show that trend line of where we've been over the last 20 years. This is our sell rate, or we call it an occupancy rate. It's the one metric that has been maintained in the system well before I got here, and we still maintain it. So you can see that as the years go, our occupancy, our sell rate goes up and down. We're currently sold at 97%, so for every parking spot, 97 of every 100 have someone paying to lease that spot. In addition to those people, we also take hourly customers on top of that. You'll see it goes into 2020 when the new ramp opens. Into 2021, we're anticipating an 82 to 83% sell rate. And on top of that rate, we'll also take hourly customers on top of that. So that's where the room to grow comes in. So this is our budget breakdown, and I apologize, there is not a revenue slide. There probably should be. It's in the budget book, obviously, but I'm going to talk about revenues before I jump into expenses. So what do our revenues look like for 2020? Well, our revenues, most of them come in through lease parking and meters. And in the budget book, those are charges for goods and services. Our budget for that is $2.7 million for 2020. $2.1 million of that comes from paying lease customers, and $0.6 million of it comes from the parking meters. We'll also collect another 0.6 meters in fines, so think of citations. Parking citations will be approximately 0.6 million. So our total revenue projected for 2020 is $3.3 million. Our expenses, which jump into the slide, are also $3.3 million, and if you get down to the nitty-gritty of it, there's a $5,000 difference between the two, so it is a balanced budget for this year. Our budget is tight, but it is also what we expect, it's what we've projected, and it's where we do anticipate coming in. But our largest cost is definitely the debt service. That is an investment into our downtown. We are replacing aging facilities that depreciate annually, and we're adding supply to our system to sell to customers where we do have a demand for lease customers. The payment for that is approximately $1.7 million next year, and it's shown in the budget book. And that actually is the highest budgeted debt service payment until we get to 2027. So it'll be approximately $1.7 million next year. It'll drop by $164,000 the following year, and then it will slowly creep up again until we hit 2027, which gives us some time to react to inflation and see what the market does in downtown. Our other costs are personnel expenses, which have gone up slightly, and you can see that percentage in the budget book, but those are due to wages and benefits that are somewhat out of our control. And then you'll see our other expenses, those actually go down. The largest decrease that you're going to see in next year's budget is for a major repair project. We've taken that out of next year's budget. Typically, we're in that $150,000 to $200,000 for a major repair project. But to be extra conservative, we've taken it out for next year. Feel very comfortable with where we're at in our R&M process. This year's project, we actually seal coated our very last ramp that was recommended to be seal coated. And when you are seal coating ramps, you're basically doing preventative maintenance that isn't required. So we're to that level of maintenance now. So we will delay maintenance for 1 year, and we've done that in the past. We did that 2 years ago where we combined a couple projects. So we'll reevaluate in another year, but we're in a very good spot with our R&M budget and our R&M overall in our facilities. So the budget breakdown, I've talked about all these items in the previous slide, and all this information is in the budget book. So if there's any questions, we'll certainly answer them at the end. And our capital budget. So we don't have a capital project planned for 2020. This is our generic project that we keep open, and typically we use it for projects that kind of border on, is it an R&M project or is it truly a capital project? Sometimes those lines get a little blurred. So if it's a capital project, we do have some money where we can go fix or repair, or what a capital would be to upgrade something. If we need to, we can do that under this budget. With that, that's our budget. It's pretty straightforward. There's not a lot of frills in it this year, but I'll certainly take any questions you may have at this time.
All right, thank you. Questions? Okay, Councilor Starr.
Thank you. Mr. Nelson, take me back to the R&M budget, because one of the things that we were promised when we built this parking ramp was specifically that we would invest $500,000 for repairs and maintenance every year. I get being extra conservative, but because this project didn't work out, we're now making cutbacks for repairs and maintenance to other building or other ramps within the system. So I have a hard time, or justify that to me, I guess, rather than me trying to do that.
So we will still be performing R&M. There's repair and maintenance that is in the budget. So that's approximately $250,000. That doesn't include the salary or hourly payments to our employees. So we do have people repairing and fixing and maintaining our facilities on a daily basis. So that will continue. We'll continue all the snow removal, all the regular maintenance. If there's an emergency repair or something that really needs to get done, we'll contract for it as needed. But we're at a point where it makes sense to do it this year. Like I said, we did it 2 years ago where we combined a couple projects because we didn't have enough major repairs to do in a year. And when you don't have a major repair in a year, you don't have enough work to do, the budget or the bids on those projects tend to get driven through the roof. So since we're really at a preventative maintenance point right now, and we're sealing ramps, like you're putting Thompson's water seal on these things. We are at a point where if we can combine more stuff and wait a year, we're going to be better off in our bids and our prices. And it just makes sense because if we come in with a $50,000 or $60,000 project, we're going to almost pay double what going rates are to have if it were a project, if it were in the $150,000 to $200,000 range.
Sounds good. If I can, one more at least. One of the things when this project was presented to the council, we were told that there were the model of being able to pay for the ramp and doing those things and the stress testing that was done. So since the change in the conditions with the ramp, have we gone back and reviewed the models? Did we get PF&M as well as Walker to come back in and look at our numbers that we're still able to repay the bonding? What kind of testing have we done, and where are we at with, are we anticipating any changes in rates because of the project not moving forward?
The rates that we're projecting for lease rates and meter rates, they're the exact same thing they were before. Now, PFM or Walker has not come in and reevaluated those. We do evaluate them internally, and one thing that you can note is when you look at the bond payment, this year is our highest bond payment by far. So the bond payment goes down next year by $164,000. That itself is the R&M project that's a major project. So we'll continue to invest in our facilities. We'll continue to evaluate annually, and we are projecting long-term, but at this point, we don't see any reason that it's in danger to default.
Sounds good. One of the things that we were assured when this project was pitched to us is that by this point, you would have a fistful, I think is the term that was used when I went back and watched the videos, of long-term leases for the new facility. Where are we at with long-term leases for the new facility?
So I don't know if I said long-term leases, so there's...
You did not, Director Ketchum
so
did, which was
I did not say that. I can tell you that 95% of our leases are month-to-month. We do have a couple older contracts that are long-term leases. So to say long-term is probably not what I would look at, but we do have businesses that are saying, hey, when are you going to open this waiting list? We're ready to move into this facility. We have the River Center building. We have First National Bank. There's over 200 lease customers right there. We don't see those businesses going anywhere in the near term. In addition to any of the smaller businesses that are on Phillips Avenue that area will serve, you've got a Phillips Avenue, the Phillips Avenue Hotel that's going to open soon. And the position of that ramp is in a great position. 10th and Phillips really is one of our highest kind of demand corners to start the historic Phillips Avenue. It's in between there, and it's in between our River Greenway. So you've got the pedestrian walkway to the east. So it's in a really nice position to be in between both of those locations.
Thank you.
Councilor Staley.
Matt, first of all, just a clarification for the public. I think Kello Land reported a while back that there was talk about making parking meters happen during the weekend. Can you tell us where we're at with that? That they were going to be used more than they are now.
So when you say like you mean like the city?
Well, I don't know where Kello got their information from, but it showed up on Facebook, and there was a whole explosion of people concerned about that. So is there a conversation about extending the hours that the parking meters are going to be used?
So I can tell you that discussion has occurred as long as I've worked at the city. So for a decade, people have been talking about needing expanded hours. There was an initiative put together by Downtown Sioux Falls. They had put some committees together. I sat on there and provided advice. I don't advocate either way. I tell you what industry standards are. I tell you what I know. And there were some retailers and businesses that were pursuing that. That information got out to Kello. And Kello ran a story on it. It's not a city initiative. It's not being pushed by the city. It's something that was being pushed by the downtown downtown Sioux Falls. And it's one of the industry solutions that is available to help address the weekend parking problems.
So, but there's no plans to implement it at this time?
There weren't any plans at that time, and there are no plans now.
And if that ever would come into fruition, would that be something we'd have to vote on as council members?
I would have to reference the ordinance, but I don't believe it is. I believe that's, I don't quote me because it's in the ordinance and I haven't looked close enough, but it's possible. We would not bring it forward without vetting, but like I said, there is no plan before to move it forward or even now to move it forward.
Well, thanks for that clarification. Then I'm going to talk about referencing back to a tour that you gave Councilor Neitzer and I a few years ago before this whole parking ramp thing emerged in its entirety. And we were driving around, you were showing us the top floors of these parking ramps. And I remember we drove through the parking ramp that's by the pavilion, and you were saying it was in really bad shape. What has been done to remedy that, or is it still in bad shape?
So there's been, what was in really bad shape there was actually the concrete that slab on grade, or SOG concrete, that is, it was in the open lot portion. I believe that's when we went through there, because it's been a while. And we have done a full asphalt overlay where all the concrete was ground down on the edges, and they came in and put in a two-inch asphalt overlay to address all the cracks, potholes that were in that facility. So now we would expect out of an asphalt overlay, you're typically on a street, they're saying 7, I think, to 10-ish years. In a parking ramp, the traffic isn't as fast, typically not as heavy, so I would say we're going to get 10 plus years out of that, and that is, like I said, that's slab on grade concrete.
So that it's in good condition now?
Yeah, and we actually there was one pillar, it was repaired this year, we had some issues with, but yeah, it's in very good shape now. We went through it about a year ago with a bunch of work too that was done.
Okay, thank you. Back to the parking ramp. As I look at this, Matt, it looks to me like there is not a whole lot of ventilation in the building compared with other parking ramps that have more sides open. Is that going to be a concern for people going in there?
Nope. So we did studies when we were designing this. This has been, it goes through all the building codes. It is not a closed building. It's actually an open building. There's a percentage of openness that is required for air to flow through a facility. That facility meets those requirements, and it doesn't need an evac fan to take out like carbon monoxide. So, and if you look at some of the facade, there's a lot of metal screen on it too. So it may look a little closed, but it's actually open to airflow. And we do have one evac fan in one area, so I'm familiar with this. And so we do use them in certain areas and certain facilities, but one's not required there.
But if it had proceeded on with the wraparound businesses?
No, would not change it, would not be needed.
You wouldn't have had to have any other ventilation?
No additional fans or evac systems. It was designed specifically so we didn't have to add that cost.
And then it would always be open to the elements, then, right? I mean,
a portion of it, yeah, like our other facilities. It's never been a closed-in ramp. It's maybe somewhat more sheltered in some areas, but it's always been open.
And then just a clarification that there is $2.8 million available, and that our budget analyst just gave me this figure today. But in the enterprise fund, there's apparently $2.8 million in cash.
I
available.
don't believe that's correct. So,
well, that was the figure Dave.
actually, I mean, if you went and took that money right now, yes, there's probably $2.8 million in there. But we have some checks that are written. We have some things that are encumbered that have to be paid for with those funds. So, is it sitting there physically? Yes. Will it be taken out because it's encumbered or allocated? Yes.
Okay, and then he also gave me the debt service for the bonding, because it looks like the annual, well, and actually I thought our own finance, is Sean still here?
He is still here.
Yeah, because I think he said it was going to be like 1.3 million payment.
So I think
you said that it's going to be diminishing, that this.
So let me help clarify on this a little. So you've got the bond schedule. So, and it's a 15-year bond, so there's 15 payments scheduled on there. So the first payment was scheduled 11/15/2018. My understanding that payment was made. The next payment is scheduled 11/15 of 2019, which is this year. So we've made a portion of that payment. That payment was actually the interest portion of the bond, and it was paid early, in essence. It wouldn't have been due until November of 2019. And then the remainder of that fund has been taken, the money has been taken out of the parking fund, and it has been put in an account where it's sitting and being held until November to make that payment. While it sits in that account, we earn interest on it. So it's been allocated and it's going to be spent, but at this time, it's not fully paid. So that's kind of where a portion of it's been paid. And then next year's payment that'll be due in 2020 is the $1.7 million.
Right, and monthly, I had him just to divide it, monthly, we're going to be paying $141,000 a month. Okay,
I assume
so.
you divide it by 12, yeah.
So I guess my concern would be that we go back to the citizens again, because it's their money. We're the tax collectors. There's the tax givers, and we can say it's a tax, we can say it's a fee, but it's still coming from the people. So what are we projecting of the 300 to 350 users? What's the monthly, what are you going to say we're going to get monthly from that?
So, I think we budgeted on an annual basis, it's about $300,000. It's, we're going to be that $80-ish per spot per month in that new facility, which is consistent with all of our facilities throughout downtown for parking ramps.
So $80 a month times 300 is 224. Help me out here, 300 spots?
my calculator,
Well,
sorry.
so you're proposing how much a month are we going to be bringing in on leases? And this is, we're talking leases, right?
Yes, 300,000 a year. What is that, 25 grand a month? Just rough math.
So how are we making up the extra 1.6 million?
So this is the same process and the same philosophy that's been done in the parking system for decades, and it's the same way that we've talked about it in all the presentations. As an enterprise fund, we use our pool of money and we use that to build new facilities. If we built a new facility and charged the rate to pay for that facility at one ramp, we would have $250, $300 a month payments at one facility. And then the facility next door would be $75 because it was built 20 years prior. So to be responsible and to make it a fair payment to everyone, we leverage that across our system.
Okay, so I'm going to do, so I can say $80 a spot, 300 to 350 spots. So it is going to have, the rest of the system has to make up the difference.
That's always been the projection. Even before I started, that's been the philosophy of the parking system.
And Matt, you and I had this discussion, and my concern I remember standing with you with Counselor Neitzer in the parking lot when the second penny was coming up. I said I had a problem. You wanted to know why. And it was because, and I said to you, and I've said throughout this whole thing, I don't want to see these people paying leases, paying meters, having to get raised rates to subsidize this thing. And that was back when we had the whole package together. And the other thing, I'm just going to say this, is I was out at the airport, and they're building a parking ramp out there, and it was, I said to Dan, the airport authority guy, I said, well, what are you paying per spot on this thing? He said, $18 a spot. And I think we paid $42 for this thing. Counselor Neitzer verified that recently. It was $42. We double built this thing to support it. So I know it's done. Hopefully we're going to be able to get something positive out of it, but I think it's a lesson to be learned when we're told, well, go forward, this is great. And again, that's why I want to vet things out. I think the citizens want us to ask these questions. And unfortunately, you're the only player left in the whole equation. You're the last man standing. They're all gone.
I guess you can call me loyal, but...
Well, no, they're all the rest of the people who were supporting this are not here.
And we've had these discussions in other meetings and answered these questions. And you know, to address the rates, you know, we did a parking study by Walker in 2015. That's available online on our parking website. On page 7 of that, it talks about rates. And if you look at that, it looks at parking ramp monthly fees, and it lists comparable cities: Cedar Rapids, Sioux City, Lincoln, Rapid City, Rochester, Minnesota. And if you look at that, you see we're at 67 and 37 for our range for parking ramp rates. We were actually $20 below on the, roughly $20 below on the high end, and we were roughly $16 below on the low end. You know, now we're in that $56 to $80 range. We've increased our rates about $13 to get us closer to that variance. We're still, on the high end, we're still lower than the competitors when you look at that average. So I think we were offering competitive rates, and we'll continue to do that, and that's our goal. And then the other thing is cost per space. We can keep talking about this. There's a construction cost, and then there's a total project cost. They're two very different numbers. There's a lot of additional costs in here to pay for this project. And I think we're pretty close to being in line with what national averages are. The 2019 cost per stall guide is out. It's by WGI. It's available online. So you can look that up and pull it up. Minneapolis, this would be the bare bones, stripped down Fiat with a manual transmission, and it's a very base model, precast construction, not post-tension. They are now at $23,000 in Minneapolis. Our market would be comparable, likely higher, because we have to bring all of that labor out of Minneapolis to do post-tension at this point. That's where our contractor came from. And that's just the bare bones construction. Doesn't account for the additional upgrades that we've put into this facility. Wider parking spots. We're 10% wider than one of those parking spots. LED lights. Additional facade, so the ability to add mixed-use development. All of these things add cost, and we're probably in that $30,000 a space range. But the total project costs go on top of that, and that will be for the airport too. The airport is no longer using 18; I think they're using 20 now. But I don't think they're actually going to build a facility at this point.
But I guess moving forward, if you ever wanted to build another parking ramp, then what you're basically saying is you are going to come forward with the same structural demands that you had for this one. I mean, I'm hearing you say that. And I've heard other people on the council say this, that we would have built it the same way if it would have just been a standalone parking ramp.
Well, there are higher standards for downtown too. So some of this facade we have to do because we're downtown, because some of the new building standards, and it increased cost. And in downtown, it is a little more to build downtown.
Councilor Erickson.
Thank you, Matt. I appreciate your cool, calm demeanor, and you're always so statistic driven, and I like that because it is an enterprise fund and it is self-sustaining system wide. So I appreciate that. I've heard the words, this parking ramp thing emerged, back to the parking ramp, and concern, I think 4 or 5 times. And I find it very fascinating that with all these concerns around a parking ramp and the enterprise funds, that we want to create a program and give that money away for another program. And so I find that very interesting. I'm not asking for any feedback from you, just making a statement and making sure that you realize that I appreciate all the work that you do to making sure that this is the most successful as possible and that this is not falling on the backs. It is tight, and I get that, and that's because of your leadership through this process, making sure that you are going to make this enterprise fund work for everyone. So thank you for your time.
Mr. Chair. Yes, thank you. If I can follow up a little bit, I guess that's interesting because if we're going to talk about what we hear over and over again, I keep hearing the words we're tight or it's close, but I don't see numbers. And we're a couple of months behind on our quarterly update of where we're at. So maybe my next question is, where are we at compared to the guaranteed maximum price? Where are we, how much bond funds have we released? And maybe just the whole update of where we are on the project.
So we are scheduled right now to open in June of 2020. Obviously, there was a design change for some modifications that has gone through with JLG, the architect. We don't have all those designs back in yet, and once we get those back in, they will be priced by Journey Group. Hopefully within the next 2 to 3 weeks, we'll have those. So then we'll reevaluate to see where we're at. These aren't major changes, but obviously when you take something off the top, now you need roofs on your stairwells. We have doors that went to nowhere that needed to be infilled with concrete block. So there's some things we'll need to do to make this facility usable in June. So like I said, we're working through that. Don't have an exact number yet. I mean, we still have a fair amount of contingency available, but once we get all the final numbers, we'll be ready to move forward and have that discussion.
I'm trying to figure out when we're in the middle of a budget presentation and numbers, and you use a term like we have a fair amount. It concerns me when the community's there that we're not getting actual numbers of where we're at. I don't get away in my job to say, oh, we're close, or we got enough money, or it'll be okay, or trust us. We've been down the trust path with this project quite a ways, and we're still not getting accurate answers from you then when you use terms like that. Can you understand why that would be concerning to the public?
Absolutely, and I'm not saying trust me. I'm saying wait till we have the numbers and then evaluate the numbers.
Then give me the number that we spent extra on this project than if we would have built a standard ramp for the needs of downtown. We have extra dollars into this ramp. We've spent extra to support a facility next to it. How much?
So I wouldn't be able to break that down specifically. You could go through the project and analyze it and strip it all out. I would estimate roughly it probably cost about what the building rights or the development agreement costs roughly were. As they did that evaluation, which was quite some time ago, that the additional foundations, the cost to do a couple things in there would be roughly $1 million. I mean, that's kind of a rough estimate. That being said, we also saved a lot of money by working in a partnership. So we got really good pricing on the concrete. Unfortunately, the other portion of the concrete didn't go up, but the price we got on our portion of the concrete was low bid by $1 million.
Which means the contractor that provided the concrete took a loss.
They
By
did
providing it
the
because
contract.
they thought they were going to get a full deal out of it that they won't in the future. I mean, there's a lot of people who've been hurt by this as well as the citizens of Sioux Falls, and it's frustrating when we want to talk about numbers that are rough and there. I think the number's higher than that. We had to build that. So I guess I can go back and take that. Maybe we'll use our budget staff to do that, or maybe we'll use the audit staff to go through the process of how much we spent extra, or trying to figure out exactly where that is, that additional cost to the constituents and the residents of Sioux Falls, as well as the users of this. So that's as much frustration as I can do.
Councilor Neitzer.
Just a couple comments. First of all, this ramp is probably going to stand for about 80 years. Most ramps around the nation are now built mixed use. The construction cost versus the all-in cost is $42,000 figure versus the $20,000 figure, as that document you have speaks to. All of those, that $20,000 doesn't include architecture fees, doesn't include bond fees, doesn't include all of the things that go into it, and people know that, but they like to mix the apples and oranges to make it look like it was a big boondoggle. Places like Sanford, a lot of institutions build their buildings bigger and more foundation, knowing that someday they might want to go up to leave themselves an option. And there's a lot of people where they regret it later. They go to build a jail and they go, oh, well, we didn't build it big enough. We're gonna have to go sideways. We can't go up. Here we've got 80 years, and I'm just going to encourage people to take the long view. We don't have this option with the rest of the ramps. Somewhere down the road, somebody's going to look and say, we have a ramp, we have parking in the best part of downtown, and there's going to be people chomping at the bit, and they're going to be on there, and we're going to collect enormous amounts of tax revenue that's going to well dwarf what we've put on. Yes, you pay extra to get extra foundations, but it gives you the options going down the road. We don't have that with our ramps. The rest of our ramps are ugly. It's because what ramps are, they're concrete, and we don't have that option. So I'm just encouraging a long view and believing in Sioux Falls.
And I think it's fair to say to that point is that History would say that that's what will happen here. Every ramp we've pretty much built in the downtown area has been part of a mixed-use development. They may have looked different 20, 30, 40 years ago, but that's how they were built in Sioux Falls. If you look at the First Avenue ramp, that was part of the Shriver project. Lots of people saying it wasn't going to work, it was going to go bankrupt. Sure enough, we were adding on to it within 10 years. 8th and Dakota, that ramp sat empty for a long time. It's actually built to go up another level. It's sold at nearly 100% right now, and now we have a city center building next to it, and there's a lot vacant to the west. Block 11, same thing, was actually built as part of a mixed-use initiative. It was supposed to have a hotel attached to it. The hotel didn't come to fruition, but the DocuTap, or the current DocuTap building, is attached to it by a walkway. And it's been full for years. So these ramps, they're always controversial. That's not anything new. The river ramp was controversial when it was built in the 50s. This one has been controversial now. And I think it's appropriate probably to read you just this, because I've been sitting on this for a decade, and it's probably now's the time to read it. So it appears that the certain business interests are interested in developing a parking ramp with a highly questionable need in order to enhance the remote possibility of developing whatever development. And talks about the cost factors of the proposed ramp appear much higher than the comparable projects. For example, and they cite another ramp. We've heard that argument. The present ramp facilities will clearly show a very definite absence of crowding, especially at the top levels. We've seen the pictures of the empty top levels of the ramps. It happens. But it appears that this could be a large margin for exaggerated need. I think we've heard that also. So the criticism was there in the past. There's a Hall of Shame nominees in this article. In here, you can see that there's empty pictures of the tops of the ramps, that these would never work. All these ramps are now paid for. All of them are revenue generators for the city, and all of them have helped with the vitality of our downtown and what it is today. And it's because people took a chance, and history says that it works out in Sioux Falls because we've got a great town. This is actually the Sioux Falls Gazette. 1987 is when it was written in June, and it was when the First Avenue ramp was going up. So, like I said, this isn't anything new. We'll get through this. There'll be development there someday. I fully believe that, and it's going to make Sioux Falls a better town, just like all the ramps and the parking system has for nearly 50 plus years.
Anybody else? Councilor Staley.
Matt, isn't 8th and Dakota, doesn't that have a lot of city vehicles in it?
It does.
Because you said that was full, as if that was like being utilized by, it's being utilized by the city.
Yep, and they pay lease parking just like they pay for their water or they pay for the garbage service, and we charge them for that. And if they weren't leasing it from us, they'd have to build their own parking to support those operations. So it's actually a pretty good value, I feel, overall, and they're getting the same group discount that we leverage across the same system for everyone. So I think it actually makes it a little easier on the taxpayer. They don't have to pay as much for parking.
Councilor Neisert?
One last question, something that's occurred to me. Downtown, the worst use anywhere, frankly, is really a parking lot, but especially downtown. We thought about long-term, what would be really great is if we could find some low-performing parking lots that we own, RFP them, get something going vertical, get the property sold, and then that would shift more people, into ramps. I don't think you'd ever get rid of, some people are going to want surface parking and you're going to need it in certain locations, but there's got to be somewhere, where the land could be so much better used if there was something there,
Absolutely, that's always on the table. It was on the table, I can tell you, under the last administration. It's on the table with this administration. We'd be open to selling lots if the price was right, and we entertained it before. We're entertaining it now. And typically with the smaller lots, usually those are assemblage pieces to get a larger piece of land so they can build a bigger development on it. The only thing that, from a parking perspective, is when we have some really large pieces, like the parcel we're developing now, we have a couple other parcels that are about that big. One of them was actually where City Center is now, and now that's the building. Parking ramps fit efficiently only on a certain size space. So, if we sell a really big piece of land, we lose the ability to put something there in the future. And honestly, because our system is so efficient, it's hard for the private developer to come in and build a parking ramp as just a parking ramp and compete on a cost basis. They can't because our costs are too low. So the citizens, they benefit from that. The citizens benefit from free parking on nights and weekends. So there's a lot of advantages to the citizens, but we need to make sure we keep those large pieces, and we need to realize that it does make it harder on the private business just to do that on the private side.
Sure, thanks.
Anybody else? All right, thank you. Okay, so we're reviewing here. What time do we have till about 6:30? What is our? Yeah, we need to have public comment by 6:15, so I would say if we're for certainly moving at least one item to back a week, and we'll see how this one goes for another one, but we will welcome up our Director of Planning and Development Services. Don't be in a rush, I'm just updating people where we're at.
Good to know. Good evening. It is evening now, isn't it? Yeah, moving into it. Thank you for your time. It's been a real ride for these just a little over 2 months, and to be here in front of you tonight. So I thank you for your time and your attention, and we'll move through this as fast as we can and being thorough. A couple thank yous. I want to thank my staff, particularly Butch Warrington, Matt Tobias, and Shelley Unruh, who have just been tremendous support, and you'll hear from Shelley a little bit later where she does her housing budget. Their input and their work during this process was invaluable to me, especially coming in new. And I also would be remiss if I didn't thank Amber Gibson and Tim Conda, who are our budget analysts under Sean's leadership, and just tremendous, tremendous support. And we certainly wouldn't have been there without their help. Yeah, that's us. All right. I too do not have a video. We didn't get to our department yet, but I think we can tell our story in another way. Our department consists of 57 FTEs, counting myself. 23 are in building services, which are the inspections and the plan reviews. Every plan that comes in, every building has a plan that is looked at. And 21 of them are in the development services, which is Matt's area, which includes planning, zoning, the permit techs, Sam's FTE and transit is in that department. And also Russ Sorensen with the arts, the support sculpture walk, the visual arts commission, that type of thing. There are 12 FTEs in housing, and those FTEs will be in Shelley's budget a little bit later. So as we move forward in the numbers with the dollar amounts, think of building and development services. One of the things that people ask me about my move to the city is it what you expected? In a lot of respects, the day-to-day is, but the volume and the velocity that comes in is really incredible. Last year, these numbers are for 2018, and this is primarily on 5 people that are primarily tasked to answer the phone. Almost 57,000 phone calls went through our department. Our 3 plan reviewers reviewed over 4,350 plans. 3,600 of them are residential and 670 were commercial. And of course, remodels are part of that as well. So it's not all new, but it's all new construction in some way or another. Additional things include the number of plats, subdivision plats for 275, and the total covering a total of 1,000 acres. Over 6,800 building permits for a total building permit valuation of over $786 million last year. As I mentioned, under Butch's leadership, we have inspections. Last year, our people did over 59,000, or pardon me, almost 59,000 inspections. 51,000 of those were in our building, electrical, plumbing, and mechanical, and over 7,000 were in code enforcement. That equates to our department, if you take the 260 working days, take off the 10 holidays, that's 235 inspections done by our department per day. They've asked us to talk about our BHAG. The BHAG for Planning and Development Services is to increase or to achieve a 90% satisfaction rate. We've tied our new, there's a new permit tech in our budget. We've tied that dollar amount to that BHAG. And one of the things we found, and one of the biggest complaints, is time. Our developers want to know, they want the permit turnaround faster, and also they want it to be more predictable. So one of the things, to be honest with you, we did not have a way to measure customer satisfaction. And so Matt Tobias has been working with IT, in particular John Clemmy, and just to set up baseline, we came up with a simple kiosk that sits by our front desk, and it has a smiley face or a frowny face, and that's kind of, and we're going to use that we're going to look at time of days, we're going to look at staffing, we're going to look at days of the week and see if we can pick up some initial patterns. They did a nice job with this initial design. I do have one design amendment that I think that we should replace the smiley face with. And I think that would be something to be helpful. Gotta have a little fun, right? One of the other things that we're working on is we have our CSS, our customer self-service, that is a portal that people can go through and access and submit plans online. We also have a component where the whole process is more transparent. They can see where their plan is. They can see whether it's at fire or health or with us, and an ability to communicate directly from that portal to our staff and who the staff is, which plan reviewer it is. And that's we're bringing online hopefully this fall. Some of the framework is done. We just didn't want to launch it during the busiest time of the year. We want to make sure our staff was comfortable with it. So that's coming, and this should help. We're engaging in a lean office. There's a lot of paper that moves through the permit process. We met yesterday with a local lean office guy to work with our permit techs, our plan reviewers, and our inspectors to go through that process to basically try to make sure that we're looking at anything that's a bottleneck. We're getting the process smoothed out, making sure people are in the right places and getting them what they need to make the process, again, not only more streamlined, but more predictable. So we can actually get a handle on where are we? Are we at the 2 to 3 weeks, which is our goal for commercial, or because of volume, maybe we're a week behind, we can tell contractors that where we are. And then the last thing that we're looking at doing is this winter, we're going to partner with the Sioux Falls Development Foundation and their partner outreach, and we're going to bring in contractors, engineers, architects, different folks in for tours, help them meet the staff. I really believe if the staff gets to meet those people and they put faces to names, they see what we do on a day-to-day basis, get them behind the wall, if you will, and have some interaction. It'll be good for everybody going down the road. I think it'll help everybody's understanding. Our budget, before we get into the budget page, is just a couple things. 42%, our overall budget is $14.7 million. But it's important to know that 42% of that is passed through, with 3.9 of it being for the bid districts and 2.7 for the TIF. That money just comes through our office and then goes right back out. And we'll get into a little more detail with that in a little bit later. We also have 11% or 1.6 of our budget that goes out to our economic development partners. And they're here tonight. They've been incredibly patient. And so I want to thank them and recognize them. Joel Basher is here with downtown Sioux Falls. Bob Munt is here representing the Forward Sioux Falls and the Sioux Falls Development Foundation. Lynn Keller-Forbes is here with CCOG. And Bob Griggs, president of Southeast Tech. And then finally, and certainly not least, Ryan Oinus is here representing the Discovery District at USD, Discovery District. So that leaves us with about 5.5 in wages and benefits. We have an additional 1.2 in operations and just a little bit of $54,000 in capital. And we'll get into more detail on that in the next slide. The next slide, there we go. So this is the budget breakdown from your budget book. Our revenue comes from general fund, the money from the bid, and the TIF to flow through as well. As you'll see, there's a $400,000 increase in personnel. That includes the $69,000 for the permit tech, which is a salary of $42,000 and roughly $20,000 in benefits and then taxes on top of that. Without that in it, it'd be about a 5.8% increase, which is your COLA, your steps, your insurance increases, the things that Sean outlined, just the general cost of an employee during his presentation. In operations, we're up about $200,000, which represents about 6.8%. Some of the things that go into that, there's $20,000 in there. The consultant for 5G is all within our department. There's $22,000 an increase for credit card fees. One of the things we saw last year's budget, is severely under budgeted for that amount, so it's an increase in budget, but it's not really an increase from what the actual ended up being. We're seeing more and more people paying online for the building permits and their fees, which is a good thing. It helps eliminate some of the traffic in our office, but there are fees, of course, with every transaction that comes through with that. And there's $10,000 in there for R&M on the trolley, and then just various and sundry other things that are in that lead to that increase. The lodging, the bid tax pass-through is actually decreased, but it's really just a truing up of where the trends have taken us. It's really not a projected decrease in the amount of the bid. It's just more of a truing up based on trends, what we expect that to really be this year. And then the TIF goes down a couple $100,000, and that's because the first TIF, the Charapa TIF, will be paid off in January of 2020, and so those payments drop off. In our capital budget, it's, as you will see, it's decreased quite a bit this year. We only have 2 projects in our capital. One is the Sculpture Walk, which is $30,000, and we use those funds to purchase the People's Choice Award every year. And then there's $24,000 for a pickup from one of our inspectors. We typically get vehicles through the fleet program. We've been short for the last year. We've actually been renting from fleet for that pickup, and this gets that pickup in our fleet and gets us caught up with that. One of the changes that we made from last year is we removed the facade easement program. There was $80,000 budgeted this past year, and we didn't use, I can't remember the amount, but there was quite a bit left. One of the things we've talked about in that program is it's kind of run its course. It's kind of done what it's supposed to do. So much of Phillips Avenue has been redeveloped and looks good. There's a couple buildings that would probably be eligible for it, the Albert House and then the apartments across, but we've not seen or heard anything from either of those projects. And so given the capital situation, we put that program on hold this year, and we'll talk about it going forward. Do we bring it back? Do we expand it? Do we change it? Is there a need to incent other parts of downtown or other parts of the city? But for right now, that $80,000 was removed for the 2020 budget, and we don't expect that to have any impact on any of the businesses downtown as far as their request for that funding. Questions? Now remember, 2 months, so remember.
Thank you.
Actually, I've got people here that can answer it, so go ahead.
All right, Councilor Neitzer.
It seems like in recent years, there was times where there wasn't enough funding for
the facade easement.
For facade easement. We had money left over this year? We didn't have applicants?
Correct.
Really? Is that the first year? Do we know?
Yeah, one of the first, if not, yeah. But again, so many of the buildings have been done. The standards has been raised, and so I think sometimes that's the intent. You put those programs together to incent activity. As activity happens, people will then make those moves themselves because the value proposition is there for them to do so, and there's no entanglements that way. They don't own, there's no government ownership on that part. They can just go ahead with that. As I understand, again, the LaBria, I probably said that wrong, the apartments and the Albert House are 2 that probably could benefit, but there's been no move, and that'll probably all depend upon if and when somebody wants to redevelop those properties.
Okay. Interesting.
Other questions? Councilor Starr.
Yes, thank you, Mr. Chair. I'll be nice, but one of the things I learned, you should never pick on your number 2. One of the things, and I think we'll get these numbers later, I was looking at the projected numbers in the budget book on page 75. The pass-through money for the Convention and Visitors Bureau being down 10%, as well as the lodging and bid tax is kind of close to that same 10%. I suppose that's expenditure. My apologies, but we'll get more of a presentation later from Terry on the budget and the bid.
Yes, so the 2019 budget was 3.7 for that, and I think it's a little bit more than that, and we've down to 3.3. But if you look back on the actual, if you looked at 2016, it's 3.1, 2017 was 3.2, and so what the 3.3 represents is more of a truing up of the averages rather than a decrease. So it had been probably over budgeted in the past years, but it does follow a growth trend, but if you look at the actuals and not what was budgeted last year.
But are we, probably more for finance, because are we still truing up on the issue with the CVB and their funding, or are we to actual numbers now, or if either one? I'll let you off the hook, Jeff.
I believe that portion is wrapped up, and of course, we were kind of outside of that because we had been reimbursed by the state, and then it was more between the state and the CVB to reconcile up, but I think that they completed that portion. And then in regard to your question on this, on the reduction that you're seeing here, you know, we were kind of a little high in what we were budgeting. It was an in and out, but we were a little high in what we were budgeting. This brings it a little bit closer to what the actual true actuals we've been seeing for not necessarily a decrease in that funding, but just more truer to what we've been in the past.
So we're not seeing a significant change in hotel occupancy?
No, and if I recall from the last, it's been about flat. I think it's been up a couple months and it's been down a couple of months. So we haven't seen a huge amount of growth on that particular occupancy tax once you reconcile out the audit piece of that.
Cool. And this is probably more planned long range. So tonight's the opportunity that we have with our partners, or do they come back later, whether it's the Development Foundation, CCOG, Southeast, that's covered now, and this is what we need to have those?
They won't do separate presentations.
They won't do, we won't see what we're.
Not necessarily, no. No,
Perfect.
in the past, they haven't been part of the budgeting process.
Thanks.
Councilor Erickson.
Thank you. I don't have a question, so you're off the hook, more of a statement. And, you know, sometimes we debate those smaller items that have such large impact for our partners that we have. And so, been here long enough to really fight for the USD Discovery District when I was in the legislature and now, and it's nice not to have that fight this year. It's nice to see it and be appreciative that that priority has stayed, along with last year was the first year that this council passed the additional funding for workforce development with STI. And so I appreciate you being here as well. And my hope for those funds that we've given is to have them back in and say, okay, what impact did this have? What are you seeing for numbers? But really giving them a full year to gather that information and then invite them back in to present. I know the city stole an asset from you with having Shelley here, and now you have Steve here. So it's nice to see you both here as well, but just having that presentation in the future to know really what the impact is and if there are additional needs or how we can partner with the business community and others. So thank you for being here and thanks for your presentation.
Sounds like a great informational meeting topic.
Yes, sure does. Thank you.
Anybody else? No? Okay, quick question for you. That Sharapa TIF, you said that's being retired next year? Mm-hmm. What was the amount term of that one?
Pardon?
What was the amount in the term of that TIF? There's a test for you.
2005 and 9 million. And I believe that was the one where the city actually bonded. It wasn't a developer's TIF, correct? Yeah.
Okay, interesting. All right, thank you. Well, nice job on your first presentation.
Thank you.
All right. Okay. Housing. Welcome.
Councilors, Shelley Unruh, Housing Manager with the City of Sioux Falls, and happy to be back before you to talk about the housing budget. My first couple of slides are going to be a bit redundant from when I came to visit you at Informational, but definitely worth revisiting and talking about how they impact our budget. So the first thing that I want to talk about is our BHAG, or our Big Hairy Audacious goal of creating 1,000 dwelling units by 2022 and how that relates to our budget. So this goal encompasses about $3.6 million of the housing budget. And to better define what a unit means, that is the creation of new or the preservation or rehabilitation of housing within the city of Sioux Falls. So to further articulate what rehabilitation would mean, that is looking at a property that would meet the substandard housing definition from HUD, or if we're investing $15,000 or more into a project, or if we're involved in 2 or more projects within a home. Any one of those tests would qualify that to be considered a unit that we've preserved for, if not for our investment, that home might deteriorate and might be a loss that we would have to take in our community. So what we're doing to really drive at that goal is we're going to be implementing the Harvard business development model or performance management model to really use data out of our property maintenance and our housing departments and other cross departments to really drive at how can we best create those 1,000 dwelling units for the city of Sioux Falls in a particular looking at affordable housing. So we've already made some pretty big changes within our programs to help reach that 1,000 BHAG goal. And I will explain that a little bit more and we get to the budget pages, but it's going to show a change in our budget, but we're really looking to be able to do more with less. And so when I get to that part of the slide, I'll talk a little bit more about that. But basically, we're going to be scaling down our neighborhood revitalization program so that we can invest more in partnerships with other nonprofits or maybe even developers in creating housing. Some other things that we're looking at doing is other ways that we can partner with other constituents to create innovative programming for creating housing. And then we're also looking at changing the way that we invest our dollars in our mobile home program so that if we're not able to support a family in the rehab of their mobile home, how can we support them in other ways with those same funds? So that's looking at that BHAG. So you can really look at our budget as two different types of housing services that we provide. We create or preserve housing, and then we do housing support services. So out of this budget, when we're talking about connecting citizens to housing resources, about $900,000 of our budget, so the other half of our budget, is going to housing resources. So there's several organizations that we provide funding for, which is, you can see a list of them up there: Bishop Dudley, Affordable Housing Solutions, the Sioux Falls Housing Commission, the Sioux Empire Home Builders, Interlakes Community Action Partnership. We do a tenant-based rental program, and we support the Bright Futures program with that funding. We also support Habitat for Humanity and Independent Living Choices. So within that budget, we have started to carve out the opportunity to create a housing clinic. The housing clinic is another BHAG goal that we have embraced in our department. And really what the housing clinic, the vision of that is helping people to connect to services. So if you have the opportunity, or if you have not had the opportunity yet, I definitely encourage you to look through the Thrive Action Team housing study that was done in 2006. It's very eye-opening about the state of housing and the need within our community. And one statement that I take from that, and that I refer back to often, is that we're a community that is program rich but system poor. So the housing clinic is a source that looks to bridge that gap and to make those connections for folks that really need those resources. Because right now, in our current system, folks that are in an emergent need or need to connect to those resources have to call a resource number. They'll get a list of those services that they could potentially get help from, and then they have to call through that list, visit those organizations, fill out those applications, and to see whether or not they may or may not qualify. All the time, they're still trying to work, they're still trying to take care of their family, and they still don't know how to safeguard their housing. The housing clinic would help to streamline that vetting process, get them to that needed resource quicker, and then do that necessary follow-through to make sure that we've helped them stabilize their housing and then move on to the next person. So that's one element of what the housing clinic would provide. That will be a 3-phase implementation process, but we're in the very infancy of building the housing clinic. So what we did was we put part of our budget for the beginning of the development of the housing clinic. Right now, Minnehaha County, so the housing clinic would be a partnership between the city of Sioux Falls and Minnehaha County. Minnehaha County has already designated one of their FTE positions to be a housing navigator. There's currently a shared position between the city of Sioux Falls and Minnehaha County that was for the Homeless Advisory Board. That position has been vacant for a while, but that FTE remains shared between our departments. So in my proposal, I would propose that we utilize that FTE that is partly funded by the city as another navigator for the housing clinic, and to provide support to the housing navigator that Minnehaha County has already put in place because of the sheer volume that we believe that housing navigator will undertake. And then we also have about $50,000 in the budget for the beginning of the development of the housing clinic. A good portion of that, we believe, is going to be somewhere in the lines of software. This is a very connected type of a system where you need to be able to network and communicate with all of the different organizations that provide housing, as well as connecting with the state. So there's a lot of development and infrastructure that would need to be put in place to make this an effective system. And so we have budgeted a dollar amount so that we have some funds available to start to go down that road as we develop the housing clinic. And then long-range goals would be an online housing resource guide, and that would tie to our BHAG of increasing the rental registration by 25%. So the goal of the online resource guide would be that new people coming to the community of Sioux Falls could go on to an online resource. They could enter in what their anticipated income is, and then a calculation based on 30% of their income, which is what you should be spending on housing, would then tell them what is available for rental within our city. And we could even GIS map that so that they could see what areas that they could live in and what properties would be available based off of that income range. We could go even further and we could add in fixed expenses. What if I have child support that I know I'm going to have to take into consideration, my car payment, my cell phone payment, adding in those fixed costs, and then again, spitting out a number that may then connect them to resources. Based on your income to expense ratio, you may qualify for these resources. So this would be another way to help people get connected to resources, help them identify property within our community that they could live in, because that is a challenge now, and it would also positively encourage the rental community to participate in our rental registration program, which is a city ordinance. So to talk a little bit about getting into the funding breakdown and what our funding consists of, 1.7 is our federal grants. So we have $996,000 from our community development block grant and $470,000 from the home funds. We'll be carrying over roughly $200,000 from CDBG into the next budget year and roughly $64,000 from home. We also, for the general fund, we receive about $1 million. That's an increase of about $100,000 for just the normal steps, wages, and COLA. And then in addition to that is some money for the Housing Summit for that to continue. When we look at the program income, we expect that to be relatively flat for the year. And then when we look at the revitalization revolving income, that is going to decrease because we're going to go from building 20 homes like we did in 2019 to just 5 homes in 2020. Another thing that you'll see under other revenue would be the state flex. Is going to be a little bit lower due to saturation and interest over the last couple of years. However, one of the things that we've done with our state flex, that's in our rental rehab program. So currently in our rental rehab program, to qualify to apply for those funds in rental rehab, you have to be within the I-29 corridor. We've expanded that territory to include the entire city of Sioux Falls because in looking at some data that there are properties that are outside of the I-29 corridor that are aging and could benefit from our rental rehab program. So we are going to be expanding that territory in hopes of getting more utilization of our rental rehab program that we do with the state. Looking at our budget breakdown, when we look at the rehabilitation, again, like I touched on, that state flex, we're expanding the territory. Our mobile home program is going to increase slightly because of Project Tom, which is where we're going to look to invest resources in helping people in mobile home situations where their home is beyond repair. Independent living modification is where they do modifications for disabled persons in their home, and they asked for $10,000 less this year, so they didn't ask for as much. Where I want to spend a little time is looking at the revitalization and the development housing projects. And these two programs should be looked at in conjunction with one another because overall it's going to be down by $2 million, but as I talked about earlier, we are pursuing a new and innovative ways to invest and leverage our federal dollars that maximizes the number of the units that can be developed or rehabbed. So we're going to really look at investing our funds in ways that we can create more units by spending less. So we're trying to mitigate our risk by backing ourselves out of the actual construction of homes and bringing our cost per home down that we invest. And with that, I'll take any questions.
Okay, thank you. Questions of anybody? Counselor Starr.
Yes, thank you. Great presentation. Thank you for looking for those outside partners to get a better bang for our buck. I think that's a admirable way to look at what you're doing with your budget. One of the things, though, that stood out to me when I first looked, I think it actually went back to the director's presentation, is that we have 12 employees that are working on housing. I couldn't believe that we had 12 downstairs, and maybe that's why we have all the extra space now that we have since the department. But give me a breakdown of what those 12 employees kind of do and what their role is with housing. Just in general, I don't need...
Sure. So the 12 that, including myself, property maintenance actually came under my leadership. So I have 3 in property maintenance staff, the neighborhood associations and historic preservation. Diane DeCoyer also came under my staff. And then I have my housing specialists that operate the federal programs that we receive our funding for.
Makes a lot more sense. Thank you.
Mm-hmm.
Anybody else? Counselor Staley.
I was just, again, I'm coming back to this conversation I had with some of the neighborhood residents in the Whittier neighborhood.
Mm-hmm.
And Shelley, as I was talking with them, they said, why can't we have a TIF program for homeowners? Something that would encourage people to do things to their home and then have some kind of that property tax incentive tied with that. Do you have any ideas about how we could implement that?
We are looking at some options that we are available through some tax programs that we already have, but I'm just on the very beginning of starting to look at some of those tax programs that might benefit homeowners. One program that we do have is our single-family rehabilitation program, so they can get a no-interest deferred loan to make some of those improvements, and then they don't actually have to pay that back until they sell their home. So there is some things in existence
Right, and
now.
that's been around for a while.
Yeah.
Right. So yeah, this person, actually, this was a city employee that was saying this to me, who was very aware of how these programs work for businesses, but some kind of and I know there is that property tax rebate program that we discovered last year, that Erica Beck helped us discover. So what I want to ask you is, would it be helpful if we had an ordinance kind of pushing that through? As council members, what can we do to help kind of drive that thing forward to help these people?
Sure. Well, I think that there's some opportunity to look at some other markets that have leveraged that tax that you're referring to in particular. I know of a developer here in Sioux Falls that was able to use that in a development that he did in Des Moines. I've only had one brief conversation with that developer, so I want to bring him back in to find out more how he used that as a benefit for the homeowner in that process. So I think that there's opportunity, but it's something that I need to dig down a little bit deeper in. We also have a HUD auditor doing a compliance visit in our programs this week. And so he's been a wonderful resource where we've been able to ask about other programs that exist within the HUD umbrella that we might be able to tap into. So this has been a good week of discovery for that. But unfortunately, I don't have any good answers for you today.
So, I'd really like to be involved with that moving forward, because I think there probably are things as a council we can do. Again, I had the discussion earlier with some of my colleagues as to, what kind of policies can we set? Where can we get involved more and get our hands into things to help propel things forward instead of sitting back and reacting to budgeting information you give us? I mean, so that we're part of the decision makers you know, on the front end
Yeah,
on the thing.
no, I definitely appreciate that because I think that, you know, all of you council members also have careers and jobs in your normal life. And in that, you can bring a lot of good expertise to a number of the initiatives that I'm working on, including the housing stat, including the housing clinic. So I would love to, you know, tap into you as a council as a resource as we're developing those things, because I think it's important. The things that we develop out of the housing department definitely impact a lot of lives. And it's important to help to shape that so that when we do put these things in place, that we're ensuring that we're spending the tax dollars in the best way that we can, and that we're providing the greatest benefit with the dollars that we're using.
And just one more thing, we had that wonderful town hall meeting with the police department. And here you have these 350 neighbors coming together to talk about issues, okay? I think it would be really cool if we did something about like that within a neighborhood. In the neighborhood watch picnics and that National Night Out kind of did that. But within your department, if you could go out to some of these neighborhoods that are struggling and put that kind of a town hall thing, maybe in a church or something, where you have people come in and say, you know, how can we help you? And even if you had that ability to say, these are the programs we're going to offer you too. So you're listening and then you're also giving. I think that would be a really cool energy.
I agree. Thank you.
Councilor Brecky. Oh,
Sure.
come on
Sure.
up.
So a couple things. To your point, Councilor Staley, we do have the Neighborhood Summit coming up this fall, and I think that would probably be a good follow-up to that as those things happen. And our neighborhood specialist resides in Shelley's department. Diane works in that department, so it all does tie together. What I really want to talk about are the incentives that you talked about, and we've had conversations, and I'm really pleased that this body wants to, look at the policy and how we lead that how we lead that as we move forward with what we come up as we work through it. I will just say that whether it's a TIF or whether it's a tax abatement or a discretionary formula, they tend to work best on new construction because of the size of the increment or the amount of taxes. Because if you do it like on a remodel, or they're going to like just put new windows on or something like that, the discretionary formula is only on the improved part. And so it always is, it might not be a lot of money on like a remodel. So that's why they work better on new construction. So certainly it's a tool to incent affordable housing or those types of things, but in the revitalization part of the world, it's a little tougher. So it's not that we couldn't come up with a new tool, it's just the existing ones have those limitations.
Right, and so speaking of new tool, the city could implement something, well, like what I heard from these people on this North Whittier area is have something where if I do X amount of dollars to my property, you will reduce my property tax for 5 years or something.
Well, only on the part that's new. We don't read the
Right, on the improvements, you mean.
on the improvements. And so,
yes.
if it's a substantial improvement, it's probably a pretty good benefit. But if it's, like I said, like residing it or new shingles or that type of thing, it probably doesn't really generate much direct benefits to them. I'm just saying from an impact
Couldn't the city make that happen, though? Couldn't we make something happen where we would offer some kind of incentive? Property tax, well, I mean, anything's possible.
Well, it's certainly possible. I'm just saying that the bang for the buck, I mean, as far as building expectations and what that might be, we'd really have to take a look at that and kind of see what that does on the valuation and how that filters down to the mill levies. Yeah, but it's certainly worth the discussion. Thank you. Yes.
Councilor Brecky.
Just a statement, I've had a conversation, Shelley and I have had a conversation, and I just want to reinforce my support for the housing clinic. I'm convinced that the programs are they're not really being accessed in the way that they should be by the people who need them the most. And your openness to, the navigator positions, the clinic, and your openness to the idea of kind of, exploring ideas about bringing the program to the people, or, convening, like a neighborhood meeting and getting that information to them and then helping them, get through the process. I think that's just, it's really needed, and I'm really excited about the result that might bring. So I really want to applaud you for taking that fresh look and a new approach toward it.
Anybody else? All right, well, nice job on your first budget presentation. Thank you.
Thank you. And one thing that I did forget to do is thank my team. So everybody else went through thank yous, and, you know, being my first time in a slight nervousness, probably forgot to thank my team. So I wouldn't be able to do a budget presentation without the support of my housing team to get me up to speed on the budget very well. Sean Pritchett and his finance office, Tim Conda for sure. So I just wanted to take that moment to publicly thank my housing staff for their support.
Great, thank you. All right, well, apologies to Sam for getting bumped here, but I didn't even see him. He must have got word we're behind, so we'll probably hear from him next week. So we'll open it up now for public input on any of today's topics.
Mr. Chair, if I may just make a statement.
Go ahead.
We are now having public input. I just want the public to understand that if we have someone waiting out here to speak, that person is only allowed one time to speak to us. So that, I'm just going to talk about cell phone usage. People, if that person had access to all of our cell phones, they could be talking to us throughout this whole 4 o'clock, 3 o'clock time. But here we have a person waiting to speak. They're going to get one shot at it. And that's why I think it's a fairness issue when we talk about cell phone usage, that people in the audience get one shot at it. People on the phones texting can, if they have the right phone numbers to the right people on the council, endless, unfettered dialogue. So I appreciate people coming here physically and taking their turn.
All right, public input.
Scott Harrisman, Sioux Falls. Earlier, the police chief talked about body cams, and I find it kind of amazing that we keep putting this off and blowing it off and putting it off. We're going to spend between 20 and 30 million for a new training center that we can't seem to narrow down that number. It's a $10 million spread. But boy, if we got to spend $500,000 on body cams, it's the end of the world. I'm going to tell you something. Body cams help protect our police officers and their rights and what they're doing. And it also helps to protect the people who are being arrested. We saw an incident on Friday. I just checked the YouTube. There's been over 60,000 views of this. If the police officers would have body cameras, we could see how they were operating all the time, and they will do a better job. It is well worth the $500,000 and 2 full-time employees to have body cameras. Enough of this, oh, we don't have the money. As for the TIF conversation, it always amazes me. Like I've told you guys, I've been after this for a decade. We have $9 million TIFs for Charapa, $9 million TIFs for Sanford Sports Complex. We got $2 or $3 million TIFs for $1 million condos over here. But boy, if somebody wants to replace a window or a shingle on their house, oh, I don't know, that's kind of hard. That's difficult. I don't know if we can do that. I mean, that's literally what I hear when people come up here from the city. It's just, oh, it's too difficult. But it doesn't seem to be too difficult giving millions of dollars to $1 million condos. That was a snap. It's not difficult. Get it done already. And I'm glad Teresa said, bring us in on the conversation, because I think it's going to take this body to get it done. Because city employees aren't going to do it. You're going to have to get them to do it. You're going to have to pass an ordinance, and you're going to have to get the state legislature involved. You're going to have to kick some butts. But enough, again, giving TIFs to $1 million condos. They don't have an economic impact on anybody in this community. You start giving TIFs out to these smaller neighborhoods downtown, they're going to start fixing them up. They're going to be a lot better. It's going to be a great economic benefit to these hardworking people, because they'll be able to spend their money on something else besides taxes. They'll be able to spend it on fixing their homes. The last thing I want to talk about is the parking ramp came up. I want to remind you guys that the plan was to build a hotel on top of this. And now all of a sudden we've spun it into, oh, it's going to be something eventually. No. It was to be a hotel. That's what it was built for. That's what we spent the extra money for. We didn't spend the extra money for something else eventually down the road. I mean, seriously. I can't believe that nobody here, city employee or city councilor who pushed that through and helped approve that, hasn't apologized to the public for the fiasco and the fraud it was on us. It's a joke. We just found out last week something we've known all along and we were warned about, that Norm Drake and Legacy Development was tied in with Hogan Construction. The court order said it and said they have to pay millions out to the settlement. We knew that. We went in business with him. It's a joke. And yet nobody here, all I heard was the two that voted up here that voted for this making excuses. Well, eventually it's going to be something someday. Wow. That's what you do with $26 million of our money? Just make excuses? There's a term I often use, and I'll leave you with this, even though I have a minute left. It's what I always tell people when they try to take something that isn't very good to begin with and try to make it into something better. And all I heard today from the guy who runs the parking division was polishing a turd.
Bruce Danielson, Sioux Falls. It's kind of hard to follow that because several of you up here on this body know the mistakes that were made with the parking ramp and what that's going to be costing us for a long time to come. And it isn't just 15 years. It's going to be costing us for decades. I heard an excuse made today. I've heard countless times we've got a parking ramp that's going to last for 80 years. Theoretically. We don't know. We don't know what's going to happen in this town in 80 years. Maybe we aren't even going to have cars to park in parking ramps in 80 years. We don't know. We have that discussion that was held on the parking ramp. And the reason why we are doing the petition drive to rewrite and redefine the city council and the city council's responsibilities with triple check the charter is because we keep running into all of the people on this body down in all the city buildings planning to spend more and more of our money. We seem to forget that we're in partnership here with a whole series of communities. I've harped in the past about how poorly done Metro Communications and the REMSA is, that we don't even have anybody working together as a community of communities to try and build this law enforcement center, to do all these other things that we need to do as a community. As somebody who was down involved with Flight 232 in Sioux City, I find the preparations in Sioux Falls are disgusting. When I brought it up at REMSA a couple of times, all they wanted to do was talk about all of the things that we might be able to do if we had our computers and we played with our computers. This is all part of the budget that we're going through. We have made mistakes in the last few years initialing contracts for parking ramps to nothing. We have a performance bond that supposedly is filed that never gets paid. This whole situation embarrasses the community. Triple check the charter, and what we're doing with the citizen petition effort to rewrite what this body can do, all involves the fact that the people of Sioux Falls are embarrassed by what we've been seeing in this chamber for several years. We have a few people in here that have been sticking up for what we the people believe need to be done, but I'm embarrassed for these people sitting out here that they've been allowed to do some of the things that they're doing and asking for some of the things that they're asking for, and then demanding that you guys vote for it just because. Thank you.
Anybody else? Okay, we will adjourn. Thank you.